We are live.
Okay, we'll get started. Okay, I'll go ahead and call the Risk Management Insurance Committee to order, and at this time, I'll turn it over to Ms. Darrenisha and Ms. Samantha. Let them present with USI and Humana.
Thank you. Good afternoon, everyone. My name is Samantha Burris. I'm the insurance technician for St. Charles Parish Public Schools. Thank you all for your time and joining us today. Today we will receive and discuss the Medicare renewal proposals, options for plan changes, and retiree and spouse rates pursuant to board policy 4.6.1 for retirement. Beside me is Ms. Darrenisha Gray, General Counsel and Director of Risk Management and Benefits. Here today from USI is Mr. David Babin, Employee Benefits Broker, and from Humana is Jody Pagewood, Senior Account Executive. And with that, I will turn it over to Ms. Jody Pagewood for her presentation. We'll start with David Babin, Employee Benefits Broker.
Well, good evening, everyone. Thank you for having us in today. We're going to be talking about our Humana Medicare Advantage renewal. We have a presentation prepared. Okay, we're going to have it online, and we have printouts for everyone. The presentation includes our actual renewal that we received from Humana. I'm going to highlight a couple points and changes for our renewal. We also will discuss just the renewal itself plus an option that Humana is bringing to the table that's an alternate to our original renewal. And then we also went to the market, and we'll see what alternate carriers came back with quotes and which ones did not. And then we'll wrap it up with potential plan changes that we could make to our plan design in order to help with some of the relief off of our renewal. So if you kind of look at the presentation we have, again, it's a lot of information here, but I'll highlight some of the benefit changes that are happening for our 2027 renewal. If you look at the out-of-pocket threshold on page 2, it's going from $2,100 currently in 2026, for our 2026 current benefit outline, to $2,400 for 2027. And this is the out-of-pocket cap for Part D. When the Inflation Reduction Act brought it down to $2,000, every year we're going to see incremental increases. So it's going from $2,000 when we originally moved to $2,400 for 2027. That's set by CMS. Right below that, you'll also see some benefit changes that are going to be taking effect for January 1st. Mia had a company, well, she was here, Jody was online when we had presented an update earlier in the year, and she commented on this. We're going to see an introduction of a 100-day supply for most Part D medications, expected to support medication adherence and reduce pharmacy visits. So that's going to be in effect for 2027. We're also going to have a $0 cost share for continuing glucose monitors. So that is a positive coming in for, again, our 2027 renewal. We're going to have virtual care offerings, and Jody might be able to touch on this a little bit, but it's a launch of Uniform Flexibility Virtual Cardiac Recovery Program, providing virtual rehab at $0 cost share for eligible members, removing traditional access barriers and expected to reduce inpatient readmissions. And then also, this was a requirement by CMS, so Humana offers supplemental benefits, and they're requiring that a portion of that go towards out-of-network benefits, and I believe it's on, is it 15? Yeah.
It's going to be page 15.
Yeah, page 15. So the Silver Sneakers program, the wellness coaching, smoking cessation, post-discharge meal program, there's a lot of supplemental benefits that our members receive through the Humana Medicare Advantage program. Traditionally, it was only in-network. Well, CMS is requiring that a percentage, I think it's 5%, be applied to out-of-network. So Humana will pay 5% towards out-of-network coverage for 27, and that was a requirement by CMS. And so that's kind of, and there's a lot of renewal information in here as well. well, but I'm gonna jump to our renewal, comparison on page 19 for our plan options.
Before you go into the renewal, were there any questions on the plan changes?
January 1st for our renewal. So we're
Because it's, I'm sorry, because it's the, not our regular plan, but this plan.
That's correct. That's correct. All Medicare Advantage plans that we've
That's
done.
the other issue, thank you.
If you're a new group, you can start a different effective date, but ultimately ends up.
Okay, cool. And this is for retirees, huh?
Yes, sir. Over 65 eligible for Part A and B. The continuing glucose monitors,
So that's gonna be, you can do that now, and we still have to have a prescription from your provider, but so you're gonna be able to order that through our mail order pharmacy, which is Cinnawell, so you can have that delivered, so you don't have to go to the retail pharmacy if you don't wish, so you can use Cinnawell and it will be a $0 cost share, as it is at the retail pharmacy today.
so on page 19, what we do is we compare our current plan, current numbers to our renewal with Humana, and then we're also going to talk about some different options, but just a little bit about what's going on in the Medicare market. So every year CMS comes out with a number that they're going to essentially reimburse or payment increases to the carriers that partnered with CMS to offer Medicare Advantage plans. Initially, CMS came out with a 0.09% payment increase for 2027, essentially flat. And after further negotiations, I believe that number ended up at 2.48% for 2027. That's well below inflation. Medical inflation is between 7 and 8%, and pharmacy is closer to 10%. So the payment that CMS has agreed to increase for 2027, again, is 2.48%. So carriers like Humana are having to make up that difference somewhere. In addition to that, with the Inflation Reduction Act, great for members, we reduced that out of pocket for prescription drugs from $6,000 to $8,000 down to $2,000. Well, the carriers are having to make up that difference in the increase of that exposure in that gap between 2,000 and 8,000. So that is an additional cost for the carriers. With that, we're seeing a lot of catastrophic prescriptions being prescribed, not amongst our population only, but across the country. And just with those two issues, we're seeing significant increases in group Medicare Advantage plans across the country. And so we're a fully insured benefit. That cost is traditionally passed on to employers. And so what we're going to talk about today is a way to help offset that increase by rearranging the way our plan is offered more internally than what our retirees can see, where Humana can benefit from CMS by separating our medical and our pharmacy in the way that works. And we're going to talk about that called a non-integrated plan, where right now it's integrated, where our medical and pharmacy actually work.
Just real quick, before we continue, board members, we've got 2 active microphones on here, so if you do ask a question, please project. Use your outside voice so that we can get it on the recording. One over there and then one here.
So again, on page 19, kind of in the middle left-hand side, you'll see Humana current renewal. The only benefit design change you will see, and these are high level here, we included in the renewal an abundant number of benefits that our retirees get to appreciate with this plan, but here just a very high level for the purpose of comparing the renewals and different plans. But the only change you'll see here is the prescription out of pocket. Again, that's mandated by CMS. That's going from $2,100 to $2,400. Everything else is the same. If you go down to the bottom, You'll see our current rate is $229.50, and that's going to $325.71. That's a 41.9% rate increase. All right. We currently have 961 individuals participating in the plan, and you'll see the amount over current is $1,116.73. To the right of this, you will see the Humana non-integrated option. I'm going to let Jody explain a little bit more what this means, but high level, CMS has programs where when a carrier files separately, there are more reimbursements that can happen on the prescription side. So Humana is the only carrier that has figured this out and been able to offer it with one ID card. So our members will not see much or any disruption. But this allows them to get a larger reimbursement from CMS, and they're passing that on to us as the employer. And you'll see down at the bottom, the benefits, well, going in the middle, the benefits do not, making no benefit plan changes, and it's a 13% rate increase instead of 1. And I'll let Jody just kind of go into that a little bit.
Sure. So, really this started in 2025. CMS began applying a different risk score normalization factor to the PDP plans offered as part of the MA PDP plan. So this change, it caused, like you said, a material increase in the RX risk scores for PDP only. So when compared to the MAPD, so in turn, as David said, resulted in a much higher revenue from CMS, which is how, it's just a substantial cost savings, as you can see here. So this is offered across other carriers. We did roll this out last year as a pilot with one of our largest jumbo groups and some smaller groups, because we just wanted to make sure, that this was gonna work. We wouldn't roll it out to all of our clients, correct? So when we started, we had to start with 2 ID cards, different things. We kind of worked out all the kinks. And so with this non-integrated sole carrier offering called NISCO, the slang term is called decoupling, if you hear that term anywhere. So now we've made improvements, and as David said, we are one of the only carriers that's kind of figured out, how to do this. So now it's 1 ID card, same providers, same network, same pharmacy, none of that changes. We are just operationally in the background doing this. You don't see a difference. The only difference you're gonna see is you would get 2 communications for your annual notice of change. You're gonna get 1 for MA and 1 for PDP. Anything coming for enrollment is gonna be 1 for MA and 1 for PDP. So your communications are gonna be double. That's the only change you're gonna see. Everything else stays exactly the same. So we feel really confident after the pilot, like I said, with one of our largest groups, there's going to be very little disruption, and it's a great cost savings for the group.
With regards to member disruption, would be that they just receive a new member ID card.
So you would receive a new member ID card, but all Humana members are receiving a new ID card in 2027 because we are changing the layout of them. So every member would, regardless, be receiving a new ID card. So your Humana ID would also stay the same. That would not change.
But so when they receive that card, would they be a letter in here saying, hey, card's different, make sure you discard the other ones, am I right? Are we gonna do something that's gonna really let them know that?
So we are gonna send out
Okay.
communication, so it's still 1 ID card, so you don't, really nothing you have to do different.
Okay,
It's just like you were doing just keeping your integrated plan, and you had a new ID card in 2027, because that's what you would still have.
right.
Nothing different, you're just gonna throw away that old card, your Humana ID is still the same, and you're just gonna have a new card.
That's what I'm going to make sure that we're gonna tell them to throw away the old and you have this new one. Okay.
In addition to Humana's communication, risk management benefits can also communicate these changes to retirees well in advance, so that they are aware that a new ID card is coming. And retirees on the Medicare Advantage plan are accustomed to receiving a new ID card each year. But we'll make sure it's communicated well in advance. Yes, ma'am.
In our industry, famous for acronyms, MA is the medical side, PDP, pharmacy
I
side.
look on, because
Sorry, yeah, I know.
and looking for as an education barber, definitely, so.
So Mr. Babbitt, just come out, like, as our broker, this is the first time I think we've heard this type of plan and option. So from USI's perspective, what are the overall benefits you feel we're gonna reap aside from the cost? Because somewhere, there's no meal that's reduced, somebody's not picking up the tab somewhere. So how is it, what are they actually pulling out so that really that cost share is not obviously being passed on us, it's being passed on to somebody else from that standpoint?
Sure, so, understanding, from the carrier side, the reimbursement comes from CMS, because when you file it separately, and the prescription plan, once from CMS's perspective, they have basically programs set aside to have a larger reimbursement back to Humana when you file it separately on prescription. So the extra cost that Humana is burdening because of the Inflation Reduction Act, by separating it out, CMS is gonna give not exact, but a large bucket of that is coming, from CMS, and they're just passing that on.
And other carriers, are obviously, all carriers are doing this in some form.
Right.
Yes, ma'am.
They're not managing it as we are. I would say ours seems to be more efficient, but all carriers are.
And then what were some lessons learned from Humana's part when you all piloted this with whatever agencies you piloted with? What were some of the, because I think from what Ms. Becky Weber's question, communication is going to be important for us as well as Humana. What are some of the things that you all learned from the trial period with those companies?
So we started out with 2 ID cards. CMS said, no, you have to send 2 ID cards. So our pilot, they had to have 1 MA and 1 PDP. But even with that, and some of the other changes, there's really no other change. Like I said, everything else is operational in the background. And I will say, our net promoter scores are higher. We're higher on those plans when we piloted than they are just with integrated. So to be honest, it all went off without a hitch.
So it kind of sounds like when we went self-funded, we were able to get those prescription rebates and self-funded to offset some of our costs. This is similar to what went on there.
That was my question. That's really similar to that. Is that accurate, as Mr. Art said?
So when you went from,
Well, we used to be a fully insured, and then we went self-insured.
yeah,
Because we would get the pharmacy rebates. Prior to that, the
Okay.
carrier,
right.
they would get no
so-
rebates and they
Yeah.
weren't sharing with us.
Right.
So now,
So what we're doing is we're passing this savings on because we are getting, more reimbursement from CMS. So we're getting that additional reimbursement. That's what they found by separating the 2. So separating this on the prescription side, the reimbursements are higher. So we're getting reimbursed for every member that's on the plan. Those are higher. So we're taking that savings and passing it on to the group.
And from a member standpoint, if members have questions, would they still call the same Medicare, Humana Medicare number? There's no separate phone number for the medical.
No,
versus
it's the same. So we have a dedicated group Medicare customer service line, which will be very well versed in everything that they would need to know about a non-integrated.
And Superintendent, to your question as well, it's always trust but verify. Sometimes it can sound too good to be true. And a lot of our discussion has been, all right, what disruption are we gonna see from this? And it really, from the member's perspective, should not be any disruption.
My only question is on the communication piece, and I know we went through this a while back, and I don't remember if it was on the retirees or the active employees, but it was something to do with whether we had good emails or good addresses. I don't, was it retirees or was it still?
So, it was for wellness.
Okay, I'm sorry.
So
I'm fixing that.
retirees on the Medicare Advantage plan, the risk management and benefits department, we mail any communications to that group of members. So we will mail communications to the retirees on the Medicare Advantage.
Do we have emails for that group? Can I suggest maybe trying to get, let's be honest, look, I understand the communication, communication meetings vary by age group. Totally, I know that in the marketing world. Well, let's be honest, even today's world, like, you have to have an email, right? I mean, so when you look at retirees, you have people that retired that are, I don't know, 50s, 60s, they're custom to have an email. Just that, I mean, it's a quicker, I'm just saying, it's a quicker way, like maybe a QR code or, I don't know, email a certain email, I don't know.
We'll follow.
Just want to have an idea out there, like, to help you guys and us in general.
Yes, sir.
And if you have any other suggestions, so we have mailed, tried to mail the QR code to get them to scan it.
They may not understand it, I get it.
We did the in-person, when they come in and give us their email addresses, a lot of them say they can't read all that paperwork online, so they refuse to give us emails. Once we get to that certain age group, they didn't want to communicate via email, so that's kind of our pain point with that age group. But the retirees who are not in that age group, we do have keyboard emails.
And I'm not saying not to mail, what I'm saying is do both. But you can email and say, hey, here it is, oh, by the way, it's on the way. Because let's be honest, a stamp these days costs almost $1 because there's not much mail going out. I mean, it might come a month later.
I'm sure you can reach out when we have the teacher's retirement meeting.
Yes,
You can surely go there and say, look, it's imperative, because we really wanna make sure.
We don't want to rely on one key.
Even though they don't see, they're not gonna see any changes, they're gonna be called.
Yeah,
Because they know that something's going on with their insurance.
Yeah.
You'll get a call.
Well, I'll get stopped at Walmart, one of the two.
yeah, you always give yourself time to go to
Yes, sir, we
Walmart.
do certainly do both methods of communication.
Yeah, I think the teacher's
Just be honest.
retirement is really good.
Yeah, I stopped at Walmart the other day.
Any other questions regarding the non-integrated decoupling option before we move on to the other carrier and then other options as well?
So Aetna and United Healthcare declined a quote because they were not competitive, so they did not release a quote to us. Blue Cross did release a quote. You'll see they added in $1,000 out-of-pocket maximum. This is Blue Cross's richest plan that they offer. You'll see the emergency room also is a $50 copay for each visit. That goes towards $1,000 of out-of-pocket. And then the $2,400 for prescription remains the same. That will be standard. Prescription drugs. So Blue Cross has a preferred and standard pharmacy. So depending on what pharmacy you go to, determines what your prescription copays will be. So if you see a preferred pharmacy, you have one set of tiered copays. If you see the standard pharmacy, it's a different tiered formulary. So that's one of the key differentiators in pharmacy with Humana. We don't have a preferred or non-preferred, as long as it's an in-network provider, you get to see the one copay system. With Blue Cross, it's tiered. You'll see prescription hearing aids, a little bit higher in allowance, and a little bit higher for contacts and glasses. All the way at the bottom, you'll see that came in at $280 or 21.99.
So I think it's safe to say that Blue Cross is not competitive at this point.
Right.
Any questions on the Blue Cross proposal?
And I think it's important too, to have consistency with our retirees. I mean, they indicate that all the time, and they're very satisfied, with Humana Medicare.
I'll second that.
And I think risk management likes it as well.
Yes.
So what we did show for this year are quite a few options for us to add in benefits, or change benefits, I should say, add in some co-pays here and there, and out of pocket to help reduce the cost. Humana provided to us a list of plan changes, and each plan change, there's an associated dollar amount that it reduces. The key phrase here is this is not additive. So in other words, when we show a plan design change, we can't say, well, we're gonna take A and B and add it together, and it's 20%, 11.28 plus the 8.78. What we've done, we've already gone to Jody and underwriting and maybe had these changes approved for the set plan designs that you see in each bucket. If we do wanna, add or delete, we would have to go back on writing, take a look at it and see if we would have an adjustment from there. But on page 20, these are primarily medical adjustments to the medical, benefits. And on page 21 are adjustments to the pharmacy. So we didn't combine the two, we wanted to kind of take a more, simpler approach where we either gonna change the medical or change the pharmacy, and if we wanna change both, then we can take a look at that as well. But on option A, that is adding in, and I'll just mention, you will see on the out-of-pocket, it's $500 across the board. It doesn't matter what change we do, the $500, out-of-pocket would, need to be accompanied in each plan design. So on option A, it's a $50 deductible plus 500 of out-of-pocket. Option B, we're adding in a $5 doctor office visit and an urgent care or a specialist visit. So it'll be $5 if you visit either one of those. And then for option C, we add in a $50 emergency room and a $100 and $50 copay for inpatient and outpatient services. And all the way at the bottom, you'll see the correlated adjustments to the premiums if we make any of these changes. So on option A, it would go from 13.31% to 11.28%. Option B from down to 8.78%, and option C 7.08%. You compare this to the non-integrated or the decoupling, these same numbers would apply if we decided to remove the traditional plan that we had. So I'll take a moment there for any discussion.
Any questions on option A, B, or C?
Will each individual retiree have, can pick the option they prefer?
No, no,
It would be up to the board to decide, should you want to make a plan change, what option?
Okay, so whatever we decide,
Yes,
that's
sir.
everybody.
we would make a decision and everybody would adhere to that one plan design. And then on page 21, we did pharmacy options. So right now we have a $10, $20, $40 tier 1, tier 2, tier 3, and 25%, which typically applies to specialty medications. On option D, we raised that to 10, 30, 60, and then 33% for tier 4. On option E, we add in a $100 deductible, drug deductible with our current copay, and then a $200 deductible on option F with our current copays. And so all the way at the bottom, by making those changes, you'll see option B goes down to 11.45%, option E to 12.05%, and then option F 10.72%.
Any questions on any of the options presented?
So if you were to combine and do both a medical and a pharmacy, are we looking at, I mean, is it a kind of just an aggregate? So in other words, we could usually tell what that 255 or that 249 would, is it kind of in the middle?
Right.
I mean, it seems like it would bring
Again,
it down
$1
more.
less than adding them together from what I found
Okay.
in doing the mix and match.
It's gonna be close, but.
It's gonna be close, but
It's an actuarial value.
Okay.
that's right.
So in other words, it's not substantial to do it.
That's right. So let's just say option A is at 11.28 and then option D at the bottom is at 11.45. So you write at 23%, give or take, let's take 23 as an even number. 23%, it might come out at 21.5%
Okay.
total. So it'll be close, but not exact.
Yeah, that'd be close, yeah.
So then that would be up to us to decide if we do make these changes, if we want to make substantial changes on both sides.
That's correct. And if we wanted to mix and match, we would give it take those notes and then go to back to underwriting at Humana and get a concrete number for us.
So the decoupling option is a viable option because it comes in, the renewal cost is less relative to the non-decoupling option, and it's minimal impact on the retirees. So, and of course, the options A through F be up to the pleasure of the board whether they would like to implement a plan change or not. Any questions or comments on?
I agree that
decoupling option is the way to go.
Yeah.
I mean, it seems,
Seems like
Moderate,
it's
moderate.
no-brainer.
right, yeah, thank you. There you go.
It's just, I think there needs to be some direction for administration relative to any potential planned changes relative to A, B, or C, and or.
When do we, the question is, when do we need that direction? We need it now, or?
Sign,
No,
If we choose to go with Humana, because you need to,
Yeah,
kind of,
We'll need direction.
December first is drop dead, but we would, I mean, if we could,
Administration would need to,
probably at the August.
yes,
Yeah,
at the
August meeting.
latest, to allow administration enough time to communicate patients to retirees and work with associated with changes.
and then would the board be interested in having a separate risk management insurance committee meeting to discuss that?
That's
Chair,
where I was
or
at.
what kind of direction would you like? Because obviously we have to select the carrier, but we can obviously wait a little bit for the plan design, for further discussion. Unless you wanted to facilitate discussion now.
2 months will
like,
be.
if we, in other words, if we had it on the agenda.
For next month, we would still have enough time. So if you can recall, at the previous risk management and insurance committee, we were tasked with coming back with several options. We couldn't get to the 14, Mr. Smith, but we got as close as possible of different things that we can do based upon the data that was presented at the last meeting. So this is the array of different options that the board could choose from to move the needle. The decoupling is the biggest thing, to move the needle, decoupling with Humana, and then the other options are how much disruption the board wants to cause it.
I think that's the best thing, go ahead and, go with the decoupling idea, prove a man as the carrier, and then come back together with insurance and look at different plan options, how much we can save there. We have to approve something, so.
I agree with that.
Okay, thank you.
I mean, I don't know what's happening.
Do it separate,
So we'll revise the
Yeah,
agenda
if
item
we do-
for.
If we do plan changes,
right,
you know, don't try to do that today, but just
that's
go
right,
ahead,
I agree.
and if that's okay with you guys, give us time.
So approve decoupling and then come back with.
So we'll modify the agenda item to vote Wednesday to just be to approve Humana as a carrier and to decouple, and then we'll come back later with plan changes.
We'll come out,
With a meeting to discuss, yes, then we'll try to aim for that August board meeting.
So they have time, I think.
And can I just give a little bit of direction about when we do come back? One of my age-old irritations is the pleasure of the board. Well, the pleasure of the board, ABC, I need to understand what those differences are
Yeah.
more than just in a numerical value. Like, I need you to tell me why we should choose A or why we should choose B and not
I
just,
agree.
here's ABC, what do you say? You know what I mean? Like, you do this work, you live and breathe it. I need more than A, B, and C are your options, what do you pick? I don't
Yes.
know.
Absolutely. So
That's-
for example, retirees, when they go to the doctor, they're used to paying nothing. If you choose this option, they're gonna have to
Yes,
pay
that's what I
$5
want.
every time they
That's
go
what
see
I
their doctor. They're gonna have to pay
Inpatient,
this every
outpatient.
time. Okay.
What inpatient, outpatient, I was thinking, I had to stop, I know what that is.
And
I
your
know a whole lot more
service
about
are
insurance than I
outpatient.
ever did before this, but I still am not thrilled.
I agree.
with all the things.
Okay.
I want to make sure we make the best decisions for our retirement policies.
Absolutely.
And then this on the last page, on page 22, we just went back to 2021, just to show you where our rate history has been. This is just kind of as an FYI, with some of the, little summaries at the bottom of what we've done over the last 6 years. And just to sit where the 13.31% is compared, again, over the years. Just from a look back period.
Well, that helps. Thank you.
All right, thank you, Mr. Babin. Any other questions before we move on to the next topic?
I love the book.
All right, and then finally, we'll discuss the Medicare Advantage retiree rates. That presentation is in Assembly under this agenda item. I'll just quickly discuss that if we can pull that on the. All right, so with regards to the Medicare Advantage rates, topics for discussion, I'll discuss the Medicare Part B premium that's payable to Social Security, the policy for computing the Medicare Advantage rates that's included in Board Policy 4.6.13 retirements, and then the 2027 retiree and spouse Medicare Advantage rates. Okay, so beginning with Medicare Part B premium. So just a reminder, enrollment in Medicare Part B is required in order to enroll in a Medicare Advantage plan, and retirees and spouses are responsible for paying their own Part B premium to Social Security. So this slide includes the rate tables for the Medicare Part B premiums. Premium is determined based on income, and the standard rate that most people pay is the $202.90 per month. That's the 2026 premiums. I will say they do increase a little bit each year, and again, Social Security determines these premiums. Next, I'll discuss the policy for computing the Medicare Advantage rates. So in Board Policy 4.6.13, retirements includes a computation for setting rates for retirees and spouses covered on the Medicare Advantage plan. The Board Policy 4.6.13 retirement, there's a PDF included in Assembly if you'd like to pull that up to read the full policy language. I'll try to summarize the calculation as best as I can. For retiree premium calculation, pursuant to the policy, the cost to the retiree is the excess of the Medicare premium over 2/3 of the total premium equivalent for an active employee on the base plan, employee-only coverage, multiplied by percentages based on the full years of employment. For the spouse premium calculation, the cost to the retiree to cover a spouse is the excess of the Medicare Advantage plan premium over 1/3 of the total premium equivalent for an active employee on the base plan, employee, multiplied by percentages based on the full years of employment with St. Charles Parish Public Schools. So what does all that mean? On the next slide. So in order for a retiree to have a premium for the Medicare Advantage plan, the Medicare Advantage premium must exceed $604.83 before the retiree will have a cost for the Medicare Advantage plan. And for a spouse, in order for them to see a premium for the Medicare Advantage plan, the Medicare Advantage premium has to exceed $302.41. So with all the plan change options Mr. Babin just presented, the subsequent slides shows the rate tables for each option. As you can see, the only option that would reflect a premium cost would be if the Humana Medicare Advantage was renewed without decoupling and without any of the options. So if the Medicare Advantage renewal premium was $325.71, as you can see highlighted in yellow, the spouse would incur a premium based on their years, the retiree's years of service with St. Charles Parish Public Schools. I know that's a lot to take in, and we understand there may be some opportunities to make changes to this policy. And we would like to request the board's permission to revise the board policy and the computation for setting the retiree and spouse rates on the Medicare Advantage.
One condition, we use the word, the filter of the word simplify in your process.
Yes, sir. Yes, sir.
So,
The only thing I would recommend, I truly think the spouse should have to contribute more, but as far as the retiree, they got end of the years, it should kind of remain, the way it is now, in a sense.
Yes, sir. We can certainly come back with proposals, so there would have to be 2 readings for the policy change. So in August, we can come back with a first reading with modified, we can show you what the premium rates would be, with options. And then we can come back with a second reading in September, and we would need it approved by October to allow us enough time to communicate any associated rate changes to our retirees.
and bring it at the same time we do the,
So
Same
I
meeting.
would suggest
Yes.
that
that
special
way.
risk management meeting, we bring both the
What do
policy.
you think?
And then, Ms. Bierce or Ms. Gray, how you'd be working with USI to determine, because I do recall this, how is that gonna, that whole piece gonna be facilitated? How are we gonna collect the information necessary to determine what our policy should allow?
So the retiree rates, the Medicare Advantage rates are determined in-house, so that's something that the CFO does the computation for. So we would work with the CFO to determine those policy changes for the Medicare Advantage, and this also gives us the opportunity to change the policy to accurately reflect how the retiree rates for the base plan and the HMO should not equal the same as well. So there's quite a few changes to clean up this policy that can be made, that'll be put into the proposal.
And Ms. Gray had, I'm sorry, I apologize, she did have a procedure done, which is why she's wearing the shades.
Yes. I apologize.
Yeah.
I had an eye procedure done and I can't see with the light reflection without sunglasses for now.
For this week.
Well, good, I'm not.
So I'm clear, just administration will come back, we'll have the risk management insurance committee reach out to the chair, determine an appropriate date, and discuss those two options, the Humana Medicare Advantage plan option, as well as, potential policy changes, making sure that we follow with the appropriate protocol and gather appropriate information that other systems are also charging as well, not just from the state, much more.
Thank you all for your time.
Thank you. Thank you. Thank you.
Agenda item number one.
That completes one A. Next is, one B, which is student accident insurance, and Ms. Gray, I think, we have someone in the audience that's gonna come up with.
Ms. Gray?
Thank you. If we could bring
Thank you,
bring
Ms.
up
Pierce.
Mr. Charlie from Gallagher to discuss our student accident insurance renewal. I'll turn it over. And this is also, materials are sending, we'll pull it up here as well.
Thank you all for having me. As we've discussed the last few years, there's been rising claims on the program. Some of that out of your hands, some of that based on some decisions to expand coverage to all students and make it as robust and impactful as it can be. If you look at the premium and paid claims history, I did include some point-in-time comparison for the last 4 years, just to show how current and prior year compared to the years before that. At this point in time, as it does take 2 or so years for claims to fully mature on this type of coverage, given the excess nature of the policy and multi-year benefit period, it can just take a while for claims to get in, get paid, and get processed. So that's where the long tail of the maturity comes from. As you look in the paid claims, you see just in the last 5 years, claims went from 78,000 to 103 to 126 to 178 in the current year, immature, but just under 100,000 paid at this stage. Those factors, the gentleman from USI mentioned, just medical cost inflation, like anything else the last few years, but also expanding that coverage a little more than we historically did, and allowing all students to utilize that regardless of their health insurance situation. So naturally, we've seen rising costs with 2024, last policy year, sitting at just under 180,000 paid. If that matures over the next year, like the year prior, at about 9 to 10%, it can be closer to 200,000 when all is said and done from a total payout standpoint. The current year is trending a little better than last year was at this stage, but higher than prior years at this stage. So it doesn't necessarily mean it's going to be better in neutral or higher, but that's the best we can do from a projection standpoint is to just share point in time comparison. So really looking at that naturally with premium previously being under 120,000, current year at 170, claims for last year already exceeded that 170, current year is trending in a similar fashion. The carriers have called for an increase. Just go out to the full market, make sure that we're doing our due diligence, get the best rate we possibly can for the program. On the bottom here, the claims paid and discount analysis. I know that writing is very small, but wanted to share that reporting from the claims administrator, just to show, give you a little insight into number of claims, billed charges, primary insurance contributions, what AG, your TPA has discounted, almost $300,000 on your behalf in the last 3 years, and then what's actually been paid. So they're at about 14, 11, and 9% of total billed charges is what they're paying out on your behalf for your students at this point in time, with the current year obviously being immature and will continue to rise. One thing that when we first started working with you all, now 3 years ago on this coverage, there was a few areas we were tasked with improving. One was the claims administration just from a service standpoint, getting a partner in that could provide, your team as well as the students and their parents, guardians, whoever's helping them to get better service for faster payments. So we've done that with AG, unless you say otherwise. From what I hear, they've done a great job. We know they do a good job. They also negotiate discounts on your behalf, again, to the tune of almost $300,000 in savings in the almost 3 years they've been the claims administrator. But also trying to find ways to expand that coverage again, opening that up to all students. So, looking at that, naturally, with claims up, premiums going to go up as a result. I did want to include some information on basically a voluntary accident component. It wouldn't replace this, but it is something that we do have some clients consider requiring uninsured, underinsured students to purchase this voluntary coverage that could provide 24/7 coverage for them for accidental injuries, but also act as somewhat of a primary layer before your policy pays. So that is something you could look to utilize if desired. That wouldn't change anything here. It would just be an added cost, added layer, but generally speaking, fairly low cost for what it's providing. So that's the kind of high level claims experience. Again, major factors include the decision to open up the coverage to all, make sure that it's being utilized fully and less out of pocket costs for your students, but also the other factors such as cost of medical care rising, driving costs as well. We're also seeing just more restricted health plans, depending on they have coverage through parents, as you all I'm sure are well versed, that we are seeing sometimes that's just not helping, depending on what insurance they have, helping less or not letting them go to certain providers and higher claims and things like that. So a few things outside of your control, but just the state.
Because that doesn't come under your control, something that's important. But this is where you can go, this is what we cover, they get free access. Whatever.
So this policy is written where there's no network like a health insurance, so you can see whoever. Typically, ideally, they're going wherever their health insurance has network coverage. Then this is just picking up the remaining balance. But if they don't have health insurance, if their health insurance is limited, or if they go out of network there's not really, this plan to still pay, it's just picking up a bigger balance at that point. And it's tough to, just with the sheer volume, it's tough to really direct care. Whereas, working with Tulane University, their athletic training staff is student athletes go here to get treatment, and we're controlling that process. You have so many students getting hurt at different schools with different levels of coordination there, so it's harder to direct and maintain that. You could put out some language about you have to go somewhere that accepts your primary health insurance and you pay. It's just tough to really coordinate that and make sure that it's truly implemented, because the plan will still pay it even if they don't. It's just your requirements to do so. It'll be tough to manage that.
I thought, and I don't know if Mr. Rogers be able to answer this, or Ms. Gray, but I thought generally speaking, when an athlete has an injury that we're through cross-train center or the bone joint clinic, that the majority of all should be getting funded through one.
From what
I don't wanna
understand,
speak
the athletic
specifically on.
directors of each school have been, given language to, this is where we would appreciate that you go, this is where we would send you. But Kate is here now, so.
Yeah. To give a little history in this too, the reason we started this for everyone was because these outfits would come and be there on Friday nights, and they were treating kids, and sometimes they weren't getting any payment because they had no insurance. So we, as a board, figured we have to, if we could provide some insurance, that they do get something, that this was kind of a way to collect on that. I mean, I don't know, 80% of our students have insurance because apparently there is a pretty good number out there that don't.
Yeah, Ms. Rogers, if you could just expand on when student injuries occur, what's the normal process, what's the information that we provide? From our standpoint, relative to this particular agenda item, are we generally trying to get students through one provider or the next, or kind of just share a little history there?
Yeah, good question. So the injury occurs at the training on the evaluation. Oshner has, some training that will, with these solutions, the contract with that training. They'll try to treat as much as they can before sending out to the provider. But if they need to see a doctor or whatever it may be, we offer them the opportunity that we can call to get you seen sooner by some of our team doctors. We can't force them to, they can still see a primary care physician or whatever is in their insurance coverage, but usually they take advantage of us having a team doctor to get in sooner. But we can't force them to use any provider that we know of, or we give them all of the options.
And that's the best in your position you can do, and you're doing more than so that's I mean.
You can't use that to get a lower rate, but it's kind of why I want the whole piece up. I actually wanted you to understand our process
Yeah.
may be a little bit different than what's normally provided to the school system, is really why I wanted you there. I didn't necessarily think we were correct in all, but at least we're
Yeah.
somewhat, we had this team down.
Absolutely. I mean, making the effort, any bit helps, right? There's really the main ways to limit claims on this coverage. Number one is everyone has great health insurance, which is just not the reality. No matter where you are in the country, where public school districts especially, you're gonna have a percentage of the population that doesn't have coverage. And then due to their health insurance, maybe if they're married, but maybe their health insurance doesn't cover the pension for that too. So there's always going to be some, but by doing that, you're at least helping the case and kind of directing there. They're also more willing to then work with AG administrators on potential discount arrangements when there isn't primary insurance payments. Typically, if health insurance discounts a bill and then pays 80% of that, it's not much of a discount to then negotiate after that. But if there is no health insurance with a $20,000 bill coming to your policy, that's where the discounts come into play. And having frequently used providers, not just a scattershot of whoever in the area, gives us a little more leverage in negotiating those discounts.
You said that in public schools, a lot of students don't have coverage, or however you want to. Is that number, that percentage increase or decrease over the last few years? The whole purpose of all these health insurance changes, it's been 6, 8, 10 years, was to get more people health insurance.
Yeah, it's that was the intent. Like depending on where you are in the country specifically too, that varies. So when we say no insurance here too, it also includes those on Medicaid and TRICARE. While they have insurance, this policy or any policy is going to pay as primary when someone has Medicaid, TRICARE, and other government sponsored plans. So there's an uninsured population, or maybe that buys we've seen a rise in Christian sharing programs that aren't true insurance, but kind of a pooling program. Those aren't going to pay primary to your policy. We've seen a rise in buying some short-term health insurance plans that aren't ACA compliant, but more affordable, but aren't going to cover athletic anxiety. So there's uninsured, there's underinsured, I guess, where they have some things, but it's just not gonna help here. And then you have Medicaid TRICARE where government plans always going to pay as last resort. So there has been over the years a rise in Medicaid enrollment, but as far as this is concerned, when a student has Medicaid as their insurance, you're paying this currently on this policy. So they might as well not have this.
So that completely defeats the point of what I was wanting us to do with the athletic trainers, to make sure that we're getting people signed up.
So in the past, you could only get this insurance, this was 17 years ago. You could only get this insurance if you had private, if you had insurance. We were not offering it to anyone underinsured or uninsured. Because if that were to happen, if you did have the last resort of TRICARE and you didn't have this, then TRICARE would take on credit. So why can't we just write it
Yeah.
to where if you have that, you're not over?
So you could make that your policy internally. The carrier filings for this type of coverage, they can't. These policies are filed with the Department of Insurance in the state as blanket policies covering all of your students for participation. They can't put in not covering if you have certain primary insurance plans. So you could make that your policy where you don't give them the package.
And that
you
would
don't
lower
file
our
claims.
costs.
That would lower your claims in the future if you were to do that. But then there's also the added administrative efforts of trying to confirm who has that, who's appropriately there, and if stuff can change during the year, which I defer to you all how you handle that internally, but that's something you could do. I can't get the carrier to write that with the policy. You could do that as your policy and everything with the student handbooks.
So can you explain how 4 years ago, before we got to Gallagher and before we switched to AG, that policy only paid, that policy did not pay as primary, and that was not something that we had to endorse, that was the carrier's part, that they only served as secondary.
So this policy is still secondary or excess. That's how it's written. It's just when there's no insurance, it's obviously just gonna pay because that's all that they would have. If there's Medicaid or TRICARE, you're always, everything is payer of last resort, or Medicaid, TRICARE is always be payer of last resort. If there's any valid collectible insurance. Now, that doesn't mean that Medicaid wouldn't, if you didn't tell the student about this and they went and got treatment, handed their Medicaid card over,
We would cover it.
they would probably do that. They could also come back and say, after the fact, that we found out you have insurance, they could audit that, that could change at some point. So also, to your point about providers not getting paid, how providers want to work with Medicaid these days, or pay off of those rates, so we have to make sure that we just keep reverting back to that old issue of your partners not getting paid.
I think the issue was a lot of these, there's a lot of athletes that go on to see these physical therapists and so forth, and that wasn't covered on Medicare. And so this policy, at least they got paid something for the services that were being rendered for our athletes.
This is a bigger conversation.
Do we know, like, are we at 20% of our student athletes are under a non-public?
And I threw it, and I.
Yeah, exactly, do we know that?
Well, and that also, when you say not on 20%, whatever percentage,
Whatever.
whatever percentage, whatever number is. So it is the term underinsured, right?
Yeah.
It's uninsured, is it under?
Or-
or under.
Yeah.
So you're,
Yes, there's two different ways.
And then at one time, since I've been on the board, Al and Mr. John, Mr. Alexander, we only covered extracurricular. But then, I think one of the carriers came and said, we can cover the entire student body, with only a small increase to cover the students, every student. And so I think that's when both creates it, well, let's just cover all the students, kids that are at the playground at elementary, or prior to that, they were not covered, it was just extracurricular that was covered.
So, when does this insurance have to be placed?
August 1st is the renewal date for this.
I mean, it sounds as of right now, our only choice is to renew as is, because none of the changes we would make would even affect it, but we as a different look at this, especially considering what that thing that you just said right there, if they have LHIP or Medicaid or whatever, this is just gonna cover it, and that will never be tapped into. And that's wild, that's just completely openly exposing us to 100% liability for every penny of it, when that would cover 100% of their care, it just won't because of it. That's an unintended consequence that we need to look at.
The only drawback there is, yeah, depending on what they have, where they can get care, depending,
Yeah,
If
where they
someone
can get
has
care, so they can't go to this physical therapist, but they can go to that.
they can find
physical
someone.
therapist. So there will be care provided, it just won't be
Direction.
specifically at this one.
There's obviously a lot of work to be done, that won't be done for us.
No, it won't.
And what I'd say is, so the carriers typically look at 4 to 5 years of claims experience when underwriting this coverage. Obviously, when we look at the last 4 years, it's just jumps into the last years
Yeah,
naturally.
it's been very.
But if you were to make this change and we document that, let's say for this coming year or whatever the change is, we can also go to the carriers in future years and say, claims for this upcoming year are already down. When we're talking renewal next year. It's not a fluke, it's because they did this, this, and this. They were writing back to kind of what those years were when claims were lower. And we can use that as part of our negotiation. I will say, just looking at your plan benefits, there's not much we can change from the coverage itself standpoint. That would really, you already have some very allocated benefits, as in covering 2,500 for surgical care, 700 for ambulance, 400 prescription drugs. There's not so much that it cut those benefits
not
down
anywhere we
too
can
much
go
to even make it worth having to cover it if we go too much lower.
Is there anywhere we can go before August 1st to change?
As far as changing benefits or
And
anything,
Reduce the premium.
yeah, I mean, if you were to, I can tell you, like I said, I can't really go back to the carriers and say, take out this, Medicaid population and what would the premium be, because I can't change the policy there. If you had a policy, I could maybe try to go back to them and say they're not gonna allow uninsured, underinsured there to utilize it. Probably not gonna change much for this coming year because they'd like to see
yeah,
proof that it was done and that claims are improving as a result. Because again, the policy's still gonna allow for it. It's your internal policies that would change there, that they're just not going to be, it's not gonna change much. So we could add deductibles, we could do some things like that, but it's gonna reverse away from the goal of the coverage, which is helping cover, minimize out-of-pocket costs for the athletes.
So is that an easy, data point for us to get internally, is how many of our student athletes are insured? So at least we can start, so then we can start having that conversation when we get to this point next year. We can start putting that.
I think we should be talking about this sooner than later.
Yeah.
You know, I mean, obviously, we have to live in a situation that all this work is
Yeah.
right there, and there's not much you can do, you think of as barriers now. But I think we need to start having those conversations soon, addressing as much of this that we can, that when we do come back, maybe like in May, we can say, okay, this is what we need to do, but I'm not gonna say, let's wait till May. Throughout, we need to be talking about this because we can,
Well, I think it's gonna be over now.
yeah, I'm like Ms. Boudreaux, like, okay, I always thought, like you were a supplement in the event that, or somebody who didn't have it. I mean, I didn't think we were, of course, someone with Medicaid or LHIP and all that. I always think they were paying, but, everybody is, everybody's trying not to pay.
There aren't any private insurance,
Yeah.
or anything like that, but for the government plans, whether it's college,
Right.
K-12, that's just how these plans are written.
Yeah.
The
Everybody
Medicaid
knows
check,
that.
I think what happened with this insurance, if you look back to 7 years on the premium, we started out 19 and 20, we had $131,000 premium. And COVID hit and different things, and it actually went down each year, okay? But in the last 2 years, that 100,000 was doubled to 200,000. So that's what throws up the big, does.
Yeah, we could very well get those numbers back, and maybe very
It
little.
might be minimal.
Might be minimal.
One thing we can do too, just as part of it's no cost, but just part of our brokerage services, is we're collecting the insurance information, basic information, carrier names, driver name, ID number, et cetera, and can share that with us. You can also run verification reports to a clearinghouse, much like a medical provider would. We do this for a lot of our college clients, so we can say, some of these that actually don't have coverage, like using an old card, or they're this percentage is on Medicaid, we can check some of that for you too this fall to get a better picture. You can collect all that data, it's just not all gonna be right, and our results aren't gonna be perfect either, but at least give you a general idea. And kind of help you have those discussions this fall and make those calls for the future. And we can also start this renewal discussion earlier. In the future, obviously, we just had the broker services and everything recently, so been working the last month or so to get this finalized. We did go out to all markets, so it's not that we left anyone off the list, it's just the carriers look at 4 to 5 years, but whenever there's a jump, they're waiting more recent years, heavier, expecting that increase, so, and it's expected different. But yeah, there's things we can do, we can help you with that data, if you're collecting that, share it, and send you the general template, and we can help kind of guide those discussions too, as well have those questions, or I would say, anything there.
Should help with email.
Okay, so risk management insurance, maybe we'll put this agenda item still on for Wednesday for the renewal, because he always want deadline, at the same time, we will have an agenda item at the first board retreat, or for that, where we can discuss these, more of that.
I was just asking, what idea?
Okay, and then in the meantime, athletics department, we can make sure that we're not already collecting, I thought we already collected that information, but if we're not.
We do.
Okay, yep, yeah, okay. Thank you, and then that way we'll verify.
It's tough to see too, sometimes. Now the cards are, someone will say, don't say Medicaid, it's UHC, but it's Medicaid.
That's the problem, that's the other issue, you know. Even put in the trainer's hands, they're not, the trainer might look at it and go, oh yeah, they're good, but it might be, in their defense, right, they're not professionals at it, it's not right for them.
Yeah, my team does this all day, so we can kind of help them with some questionable ones, but yeah, even the Christian sharing or the things like that aren't insurance, they look ministerial.
And what,
Sorry, go ahead.
well, just one last thing I want to comment. I thought on the presentation, I saw the number of claims actually increase, the cost of the claims increase from last year to this year. So in the future, especially for future discussions, I think having that type of claims that we're
Yeah.
paying out, or the top things, what are we limiting? What are we minimizing at
It's
schools?
on there.
So that's
I
high level.
don't have.
There is, I believe there's an Excel
There's an Excel sheet in
Yeah,
there.
that dives into injury, sport, provider.
What is, it looks like a lot of them fall under interscholastic sports, rhythm, what is that?
So that's just how they're reporting the claims in their system. Your coverage technically extends to extracurriculars and other non-sport activities, but the majority comes from sports.
Non-sport, like a playground or something.
Well, I mean, but we break them all out, like basketball, cross-country, track, and it looks like they're just lumping them all into interscholastic sports.
On one.
So you wanna see
the
the sports or the body part?
Yeah, just I couldn't see.
Go to that sport tab. You see,
There you go.
see, so the sport, it looks like they're all just getting thrown under interscholastic sports rather than being broken out.
Interesting.
So I mean like the football,
That's a good
Yeah.
question.
softball.
I mean, now, one year it looked like it did,
Yeah,
but like you look at,
that's a good, yeah, let me go back to the TPA, they address that.
But I'm just thinking
got
from,
procedure.
correct, yeah, just from Mr. Rogers' standpoint, to be working with
There's
coaches,
more
safety wise,
No, I think that might just be sometimes, so the claim form that gets filled out when an injury occurs and submitted is oftentimes Jeff has to sign it, but then it's also sending it to the family to sign. So if they're not clear about some details on that or vague, it might just be generally lumped there, but that doesn't explain why there's two categories, sport and student, and not some sports. I can have them go back to
I just think that the more we look at the root cause, and try to minimize costs instead of just modifying. So,
The more data you have, the more you can.
And I do just want to point out in the high level tab, the CPA tab, that does look at, that's what I just had in the proposal. The number of claims there for 2025 does look like it went down, however, we're still gonna have claims that just haven't been submitted yet, so when we look at it in 6 months to a year, that's probably gonna be closer to the 158, 163 we've had the last few years, but we'll continue to take a look at that. But you can see, I mean, just from 2023 to 2024, that cost of medical care, you had 5 extra injuries and 600, 700,000 in additional dollars charged for those injuries. So now obviously severity comes into play there, but
Yep.
similar number of claims, much higher bill charges.
Okay.
What's the lifetime of those claims? Is it a 3-6 month type?
It's typically, so generally speaking, before I'll tell you that the year is kind of complete, there's probably another year on 2024, another year and a half, 2 years on the current year. It just
So
takes
you're a year and a half after the
Yeah.
year ends.
Right. It can just take a while for the claims to go through primary insurance, for treatment to occur, because it's going to be ongoing treatment. Claims go through primary, get submitted, and then there's always the ones that get disposing collections when no one submitted it. So it's a year and a half. But yeah, you can see 2023 claims at this time last year have gone up 10,000, and that should be relatively complete. So 2024 has a little room to go.
So 2023 went up 10,000 between 25 and 26.
Yeah.
So you two to 3 years out. Thank you.
Any further questions? None, I'll entertain a motion to adjourn.
Who's it here?
Second. Okay,
Thank you all.
Thank you.
Have a good one.
You can just refer me to the.
Yeah, the resolution, and then I'll probably go to Exhibit A for a second.
I'm sorry. Gotta call the capital improvement committee to order. Thank you, Mr. Rainey, for joining us on
We're just practicing.
And we're gonna talk about
Okay.
cooperative endeavor agreement. And it's in Norfolk, so we'll love that.
The board is aware we have a long-term relationship with all of our parish entities, and particularly in this case, the parish government. This is a piece of property, if you remember, to Exhibit A, which runs along the engineer guide levy by local elementary school. We utilize this property as a bus funding for our students drop off and pick up. It allows for safe ingress and egress to the campus, keeps the buses separate from the bar riders. We've been utilizing this piece of property for some time. The agreement was just never memorialized or formalized, so, we work in conjunction with parish and corps engineers to modify the document to put this on our shared agreement. So, currently, the parish has an agreement with corps engineers to utilize this property, when they do ball games and such, on the right side of the local property. This lets us piggyback on it, join this cooperative endeavor agreement, allows us access to this property, and puts it on the course, if you will. So, our only responsibility is to maintain, the roadway and not keep it, upkept, covering the grass, weeding, which we're currently doing anyway. We pretty much solely use the parking lot, so it is of a benefit to us. So, once again, this is really just formalizing the agreement. This gives authorization, this resolution is authorization for the superintendent to sign on our behalf. If that will go through that Wednesday, it will go to the parish council, they do their part, and at that point in time, we have an official agreement in place to utilize something that is. So, any questions?
I feel, Mr. Ron, okay, you got a little bridge way that fits to the gravel part in the back, that little bridge that's over that little canal. Okay, does somebody check that little bridge and make sure it's, because you have a lot of traffic, by the experience. Yeah, so do they have people, engineers that come out there, especially with, you know, ever since we had Ida, flooding, water buildup there, so do we have someone,
It's definitely the Corps engineer would,
okay,
you know, for someone who's kind of familiar with the area, they just did a big sheet piling project along the canal to stabilize the banks, if you will. But that is a good point, it is their responsibility to maintain
okay,
overpass, if you will, as well as the canal, but I will certainly bring it up to them again, and check and make sure that they're inspecting that at regular intervals. But for us, it's more of the maintenance of the actual parking grounds, limestone, cutting the grass, checking the parking buckets and such. But I will give them to make
Okay.
sure that they're checking the main thoroughfare or road over to the next.
thank you.
Mr. Rome, so before this, someone gets hurt on that piece of property. Who's responsible
Before this agreement,
before this?
there could be some projections of the exposure there, that's why we're formalizing it.
So now we formalize the agreement, I'm trying to understand the indemnification, so it goes, to the same, we have to hold insurance on.
Yes.
So is that in addition to anything that we're currently purchasing, or is this would be an additional purchase?
Believe you're in additional purchase, so we don't have formal agreement right now.
Yeah.
We were utilizing it, whereas, you know, when people utilize the things lying along one side of the park at Blue nothing's formalized there. This is putting something into formal agreement, but as far as additional insurance, all of the factors.
Yeah, and if I could just ask Ms. Gray to come forward, because I don't necessarily, and I don't know for sure, but we should be able to enter it, it would be covered under the umbrella of our current properties, or I don't know. Yeah, let's just get clarification.
Yeah, we really need to find out because you're talking about, you know, rocky little windshield, and somebody, you know, like, are we really responsible? Is that really, like, what is that? That's a big little area that a lot could happen in.
So Ms. Gray, we're talking about the cooperative endeavor agreement that has us using the parish property, and now we're going to sign off on this cooperative endeavor agreement, which gives indemnification for responsibility for us to cover that particular piece of property. How is that considered as part of our insurance and an additional cost for that standpoint? This is next to Northville.
It's those gravels.
No, you want to see the?
That's the open,
Yeah, it's the gravel. It's the school, the canal, and it's gravel.
right, yeah, so we would be responsible for paying their developer. So after this development is signed, then this will be added to our liability.
And do you see that causing a major increase in the premiums?
So we have a self-insured retention of $350,000. So we be responsible for the first $350,000 of claims for this property.
And then my next question was, so this, let's say this goes to the parish board, and they sign it Thursday, right, or whenever it would be. If someone comes from an incident that happened prior to when they signed it, are we, like, in other words, are we held responsible for, are we acting?
You know, we are responsible from the
that
day
day
we
they-
sign the agreement, so
Moving forward?
So, Scott,
Great question.
Mr. Cody brings up an excellent question. So, and just so we can more dive into, piggyback on that, what about, say, that the piece, the strip along, crossing the lane, or even better, I think the parish, do we do a cooperative endeavor agreement for like parking lot, Landry?
Yeah, that's correct.
I wonder, if, like, you know what I mean, you see the transferable piece, like, they do. I would just make sure that we look at all of it to make sure.
Absolutely, yeah, Lulen would probably be one.
And I think it's a great idea to do this, I just wanna, say Scott's question, I think it's an
So
excellent.
the agreement would only be during school, during the school year, like from August or year round? Because you're talking about, like, I'm thinking about swim meets, kids on four-wheelers. I mean, are we responsible for anything that happens during that time? Or is it, we're gonna only have coverage from August one
No,
to?
it should be an incident that occurred with our use of it,
Yeah.
the way I would see it, not a time frame. only, it could occur during school, but it's.
Okay.
It's not written like that, there's, I mean, unless it's just implied.
So once we lease this property, we will be responsible year-round for this property, and it's not just our use because we will be responsible for it. But the liability for grounds is different than traditional property. There has to be a defect that we knew or we should have known about it, right? For there to be some type of coverage. So if you say, are you going through the parking lot, and I heard the scenario of a marking of fluid at their windshield. Well, it's not, right, it's not necessarily that we're responsible for, there has to have been, because it's just property, there has to have been a defect that we knew or we should have known about it for there to be coverage. The same thing applies to our parking lot. If we get a call of somebody who says, oh, they were driving and there was a rock in their windshield, I mean, it's not a defect in our property, so we're not responsible. Even if one of our trees falls on somebody's car, if there was not a defect in the tree that we knew or we should have known about it, then we're not responsible.
Yeah, and I know as well as, not gonna apply here, Ms. Gray, but lawyers can control that language, so we just wanna make sure that we are as clear, like Ms. Cody said, but my son's a lawyer, so I know how that language will definitely be wrapped around, so I just wanna make sure we're very clear on what's our responsibility and what it's not. Cause that is an open area over there.
So the bridge, this is what we're referred to, is that covered under this agreement, the little bridge?
The maintaining of the bridge is not, it identifies that we brought them down the bridge, which we're maintaining, which is basically the rock limestone blocking area, the entranceway to the little student pedestrian bridges that cross the road, maintaining the fence, maintaining the grass, that's our level of responsibility. In fact, originally they had something in there about maintaining the ditch, when we were going to do that. It's not an applicability nor our ditch, that.
But if there's an effect on the bridge, I mean, is that exposure to us?
It's not in the agreement that we have to maintain it, it's something that the parish has to maintain, so if something happens on the bridge and the parish is still responsible for that bridge, we would only be responsible for the little parking lot. So for example, if a crater occurs in that parking lot and we knew or we should have known about it and we didn't put more rocks to take care of it, we would be responsible.
It says all walking distance.
The walking.
Or what is, we're talking something different.
Yes,
Yeah, this is
that's
a
a
blind
vehicular
one, it's a
access.
little walkway.
And it is, actually, it's the court's property. Us, along with the parish and access. But yeah, there's two pedestrian bridges that they walk across, but you can't see.
The pedestrian bridge.
Pedestrian bridge is on here, and then also it does say that we gotta
That's
carry,
ours.
we've gotta carry it through the boat. So we cover it.
Yes, so we have excess insurance for that.
Is that, John, is that, when you're talking about the pedestrian bridges, is that the one all the way in the back and the one by the cafeteria, both of them?
We don't really utilize the one in the back, but still ours, years ago that was put in, I believe, the branch,
Right.
some emergency plans to take out, evacuation routes and stuff. We have maintained those as fast checks, we
Yeah.
check the structural integrity, we paint them, we replace components, so we do maintain the
We do, we do, we do.
And just as a point of clarification on the Landry piece, that is part of our agreement for use of facilities with them, kind of like part of the recreation agreement where we have that piece in there, so it's covered. Okay, we'll go back and look at it, make sure all part of the document.
Yeah, just, it was an excellent point, I thought, just look at that script a little bit.
Yeah,
Just saying,
and
yeah.
all of them.
Anyone have any more questions to consider on process?
Thank you, Darren.
Thank you, Mr. Rose. Thank you, Ms. Brown.
Mr. Scott, Mr. Art. Mr. Scott, Mr. Art.
The Curriculum Instruction and Assessment Committee is called to order. The members of the committee, besides myself and Mr. Alexander and Mr. Gregson. Today on the agenda, we have an update schedule for Lumen Elementary School, and present today to make that presentation is Executive Director of Elementary Schools, Rebecca McFerrin, and Lumen Elementary School Principal, Kelly Ford.
So, Mr. Chair. So this was, obviously last year was a pretty impactful year for Luling Elementary School. Knowing the most recent history of this board, myself, the superintendent, committed a lot of time and energy relative to a comprehensive school support plan, 2019-20 with follow-up, regular follow-up reporting to the board relative to the impacts of those positions and that plan to positively impact student achievement. Last year was a challenging year for that school relative to administrative leaves. At very beginning of the year, we had directed some more direct resources with direct oversight by our executive director of elementary schools, Ms. Becky McKern, and pretty much stayed at the school in order to provide that direct support for the next 4 to 5 and 6 months. So with that said, I did think it was appropriate that she be the one leading this presentation relative to kind of how we got here and some significant impact that was made in a very short period of time as a result of some of the things that we did. So I want to thank Ms. Horton for being here as well, because I know she has a part to lead moving forward. So with that said, Ms. McCutcheon. You don't mind just a little bit louder. The microphone outside, just so everybody can hear as well.
Future voice.
Thank you for this opportunity. This Orly and I will be sharing a brief update on what the elementary school has been over the past few months, what we learned, what's been accomplished, and where we're headed next. Alright, so a little bit, Dr. Orly held some of this for you of where we began this work. The story really began with listening. In October, I was invited by the school's administration to hear some of their concerns and an administrative team meeting. From there, we assembled a team of various central office personnel across many departments to conduct a comprehensive needs assessment. And beginning late November, that team started to do observations and gather data on the areas of concern that were shared. The analysis of that information, coupled with the other data that we collect throughout the year, teacher, student, family, and classroom data, helped us to arrive at a goal of stabilizing systems and building long-term impact. And as Dr. Owen said, as a reminder, there was overlapping this time period, there was many leadership transitions at the school, and despite these changes, the team that was appointed in January stayed very strong and remained focused on supporting students, staff, and families, maintaining as much stability and continuity for everyone at Luling Elementary while continuing to have some positive results, as I'll show you in a moment. So with this work, emerged 4 priority areas naturally. We organized our work into 4 success teams: instructional success team, social emotional well-being success team, a special education success team, and a leadership success team. And these 4 areas became the framework for how we made decisions throughout the remainder of the year. So I want to look at a few highlights from each, and we'll start with the instructional success team. And while I could go over a lot of data with you guys today, we'll do that at a later time. So for today's purposes, we'll share a little small portion of evidence from the instructional success team's impact. This data will highlight the success of addressing an immediate need that we noted from the needs assessment, where we had to intentionally strengthen core instruction, especially in grades K and 1. And then also it highlights.
I'm sorry, could you just kind of explain what core instruction is?
So core instruction is the instruction everybody gets. Sometimes you hear it referred to as tier 1 instruction. So it's what everybody gets the first time around. It's universal to all students. There was a need to strengthen the implementation of that for everyone, specifically in K and 1. This data also highlights where we expanded into intervention opportunities, sometimes heard of as tier 2 and tier 3 opportunities, or tier 2 and tier 3 interventions, and also to increase our use of human resources and instructional coaching. And we prioritized that for grades K1 and 2 at this time, at that time. K2 was selected as the foundation for all success at Luling Elementary for future learning and opportunities leading into grade 5. There was a much greater need of the K2 level. And these instructional decisions, we believe, contributed directly to some of the results that you'll see on the next few slides that we highlight. So, end of year student achievement, highlight number 1. I'll highlight 2 for you. this data comes from end of year DIBELS results, which is a state assessment used for all kindergarten, first and second graders. So with great excitement, we'll highlight this opportunity in this area here with a tight instructional focus on stabilizing and solidifying the foundational learning needs for primary students, a deep commitment from the curriculum instruction and assessment department, essentially led by the K2 team within this April Mosley. We're very proud to report Wheeling Elementary School showed tremendous gains for their end of year results. From last year to this year, they increased 9 percentage points. Another slide to just give a little graphic context here. You'll see that this lists all schools in the district average, and you'll see while our district results were consistent overall, it just further shows that Wheeling demonstrated meaningful growth with 9 percentage points, the highest gains of all the elementary schools. Very excited there. And the second piece that I'll highlight today is about our subgroup population and the improvements made there. This is very exciting. Every major subgroup at Wheeling improved, and several of these gains were the highest in all of the elementary schools in the district. That tells us that those improvements that were made were benefiting students broadly, not just one population. So I'll further illustrate this by going through a few of the subgroups. You'll see that our English learners increased an impressive 60 percentage points. Now what's significant to note here is that it's the only positive increase among all of our schools, but only schools with over 15 students of English learners that are English learners are represented here. But out of what we have, that's a tremendous increase for English learners. It's also a very quick growing population right now. And we look at our Black students, and these results continue the story. Our Black students increased 8 percentage points, the highest among all elementary schools in the district. Economically disadvantaged students also increased. They increased 10 points, the highest gain in all elementary schools. And then we'll look at our students with disabilities. They increased 10 percentage points. So what this tells us by looking at subgroups is that historically underserved student groups are improving at a great rate right now, and it suggests that our instructional decisions and the systems that we are starting to put in place are becoming more equitable, and the data shows that we can this improve across populations. Alright, so going back to those, going back to those major priority areas I mentioned earlier, we had a special education success team and a social emotional well-being success team, and those two groups engaged in deep data analysis to plan and begin collaboration across multi-departments for some current improvements that happened last year and mainly for some future improvements to happen. The goal was to move away from constantly reacting to student needs to work proactively supporting them. In addition, we renewed a partnership with Access Health to provide on-campus mental health services, which did start last year and will be continuing with some other improvements that this building will share shortly. All right, and then to touch on a few ideas from the leadership success team, there was much of this work happened behind the scenes. It might not have been publicly seen by students, but or families. But the priority for the leadership team improvement during this time period was to reset attendance expectations, increasing instructional continuity and student supervision. There was a high number of faculty and staff absences or parties, and this deserved our attention at the time, and it yielded noticeable results within the last 3 months of the school year. With the new administrative team being appointed there, Ms. Wortley jumped right in and she began conducting extensive transition plans across all the St. Charles Parish Public Departments. She also intentionally set one-on-one meetings, focusing in the beginning on classroom teachers and special education teachers, and she'll touch on that in a minute as her work continued throughout the summer. So I'm going to turn it over to her this time so she can talk to us a little bit about her summer work and then some plans going into 26 and 27.
Good evening. As I reflect on the work that has taken place already at Wheeling Elementary, I am super proud about how much has already been accomplished to build a strong foundation for our students, our staff, and our community. Our work began by embracing new
this mission now serves as our guiding focus as we make decisions to support our staff and work to ensure that every student reaches his or her potential. We've also prioritized creating a welcoming environment that reflects the pride that we have in Moving Elementary. As part of our campus beautification efforts, we refreshed the paint in buildings F, G, and I, which are buildings that were not included in last year's renovations to create a more cohesive campus. Through these improvements, along with partnerships with local industry and community organizations, we're creating a campus that promotes pride, belonging, and a positive first impression for our students, our families, faculty, staff, and visitors. And as we talk about from an instructional standpoint, we redesigned our master schedule, which maximizes the learning opportunities to better support both students and teachers. Our kindergarten through second grade teams, they collaborated to create online curriculum maps, common assessment, and pacing guides to ensure consistency and high quality instruction across all classrooms. In grades 3 through 5, our professional learning is centered on strengthening our PLC process and improving what Mr. Thurn mentioned, Tier 1 instruction. Teachers are using collaborative planning, student data, and common expectations. I can't stress that enough. I'm spending time talking about what are our expectations of each other, but also for our students, to ensure that every student receives strong core instruction before any additional interventions are needed. To support these efforts, we've provided grade level specific professional learning that address the unique needs of Moving Elementary, as well as the instruction priorities of each grade level. We've worked closely with multiple central office departments to strengthen our systems, build collaborative partnerships, and ensure successful student experience. In addition, like Mr. Thurman has mentioned, I have met individually with most faculty and staff members. I tried my very best from the time I was appointed in April through May, dealt with both Lakewood and Luling, but I did have to make the priority for the core classroom teachers and STEM teachers, so I wanted to really get an insight from them so that we can make staffing decisions. However, I did offer office hours during the summer where I did have people that took up on those opportunities to come in if I didn't get to speak with them during the at the end of the school year. And what helped me, because I was able to learn about the strengths of Moving Elementary, to get their perspectives, and then really establish that shared vision. And that basically, where do we go from here, but also understanding the needs of the community. And we established a partnership with Access Health. So we already had in place for the mental support for our students, but actually now expanding to physical health services on campus. So we're already in talks with what does that look like for us and for our community, because we want to remove barriers for our students and ensure that they're healthy, present, and ready to learn. So every one of these initiatives has been very intentional, laying the groundwork for the culture and systems that we want to see at Moving Elementary. And we know that with that foundation established, our focus now turns to the next phase of our work and the priorities that are going to continue as we move into the next school year. So as we look, our priorities are centered again on strengthening systems, culture, and instructional practices that we know are going to have the greatest impact on student success. We launched the Student Success Team to provide coordinated support for students. And a big part for us, and it's going back to those expectations, and although we have been a responsive classroom district since what, 1996, might be a long time, we do know that sometimes, you just get caught up in practices and things evolve, and as people come and go, so we are making a commitment to reset collectively. The implementation of responsive classroom, which is our approach to discipline, and also the 7 mindsets to strengthen our school culture. We're going to continue the long-range curriculum instruction and assessment planning to ensure that sustained instructional excellence that we know that has already started. We've also established a leadership team to build leadership capacity across our campus while providing meaningful opportunities for the faculty and staff to have voice, to have feedback, and share decision making. We've really been, time has been tight with this transition, and it's probably not what I typically would do. So we've kind of had to make some decisions, work to communicate as much as possible, but we have this team that is established so that they know that the work is going to start immediately. And then they're going to also ensure that our work reflects the collective expertise of those who serve our students every day. Superintendent says those that are closest to the work, because we don't want to lose sight of the great things that have happened, the people that are there, that work every day, and even has come out in conversations in the past. This team of teachers, faculty, staff, they truly care about these things, and they want what's best for you. Which those conversations, really, when I reflected on all of that, it came down to that thought that this year is going to be learning what I call pieces. Because this is what they are asking for. Clarity, consistency, and communication. As Brene Brown says, clear is time. And that is keep it simple, but really focus on doing things well, to being very clear about what those expectations are, and holding each other accountable for those. So that's going to guide our decision making, our instructional practices, and our relationships with our students and faculty, staff, and families. And finally, everybody knows I love a good theme. This year's theme is team. Together, everyone achieves more. And it reflects our belief that when students, families, staff, faculty members, and community work together with a shared purpose, we create conditions for every child to succeed. And we know that together we can continue with our mission, where we expect more, so thanks.
Any questions? I have a question. How many students are there?
6.
And is it the largest elementary school in the district?
We're close to like over 600 now, and we're watching.
And, you know, one thing I like, you got Luling, you got St. Rose, and you have Norfolk, that are K through 5. Whereas the other schools are K2, then they go 3-5. Without increasing staff and cost, have we ever thought about splitting the schools to I mean, being at, I think, you know, St. Rose is not as a very large populated school, but I mean, Luling and Norfolk are. But not building a school, just kind of.
So I can actually speak to that. So I actually, with my experience, so we had Norco, work with this time, upper elementary, primary, so we did have shared school. And then going to Lakewood, which 3, 4, 5 is actually when you talk about the larger school. When you're talking about the number, yes and no. I think it's really about the approach and the leadership, and the way to be able to have both. Because there are struggles when you share on the campus and you have 2 different leadership teams. And even though I think that and I have a great relationship, when you share a cafeteria, when you get down to where you had to have the line of demarcation between hallways, it really, I found personally, it actually came off and hinder, as opposed to if we look at it, and I can tell you that our approach with the leadership team is to have 1 assistant, really specializing in K2, 1 assistant, really specializing in 3-5, and 1 assistant specializing in STEM, where then I'm able to help supervise the work that's happening across and make sure that it's good. So, I just, from my personal standpoint, in having to give both and also working with a large school, I think it's doable. There's always a challenge when you start talking about grade bands from pre-K to 5. I think that's a challenge no matter if you have 200 kids or you have 500 kids. But I think we're very strategic and who we place on those leadership teams
just wanted to say one thing here, a little side note. These numbers are unbelievable. But I'm worried about it. So, I'm worried about Lakewood. So let's not take our eyes off of, let's be proactive on that so that we're not chasing like we were.
I think too, like to your point, and to your point, I brought it up, actually, you and I were in discussion the other day, I think if you're talking about the people, right? One of the people in charge of the K2, the second half of the year, and the reason you saw those numbers is not your principal. So I'm wanting to start, you're not wrong,
right?
You're not wrong, I wanna give you, I'm just tired of the people, and I think we actually might have struggled with that.
And I, if I can speak also that, we've gotten, sometimes I'm like, Lakewood, last school year, we asked for help from the special education standpoint, and Mindy Van Hoven and Antoinette Linker began stepping up, to really come in and help to support us at Lakewood. And I know the things that we put in place at the beginning of the year there, and the vision moving forward and supporting the needs of the students at Lakewood, I think there is to be great things. And I think and even when I shared with the faculty and staff when Ms. Hyden was selected, I thought there couldn't have been a better person, considering that she's been at most of the things she has, her knowledge with early literacy, and also the struggle between Mimosa and Lakewood is from second to third grade. You'll notice that has been a struggle over the last 3 years with that population of students and their needs. You'll see when they're fourth and fifth, we start rising back up again. So I think if anything, probably Lakewood's in a better position than if I were leading them, because I really feel like they have great things in place and they're set up for great things. So I think continuing the support in special education, and then also the support for literacy, I really think
Transition meetings I've had to pretty much all of those special education processes and plans that they have in place so that when we continue to chat with departments over the summer to have that work, continue to learn about that work. And then she's had this unique perspective of digging over the past few years at students' data from looking at their first grade school, second grade school, and looking at third grade, and trying to find some trends on how do they do once they transition to fourth. So really emphasize that 2 to 3 transition is really big, and she was going through this.
she's gonna do a better job.
I have sorry, go ahead. Communication. Look at next step. It might take a minute. Looking at this and then thinking about other things that we do, your position specifically, I'm coming at this from the lens of like the teachers do a PLC where they get together and they talk about their students and their student staff and their class with other third grade teachers, okay? So do we have, or could we, is this on the radar of anyone after something like this happening? I know that we have principal meetings, I know that we gather together. Are we gathering together and saying, all right, you're at Lakewood now and you're at Lewin, and supporting each other and saying, we're doing this and we're trying this and this is working and this, I know that this would come under like your umbrella. I just want to make sure that everyone is still feeling supported. Like there was so many people at Lewin last year. Great job, Kelly. Good luck. See you later. Like we cannot do that. We cannot do that.
And I'm glad you said that.
Okay.
A few points. We are at the verge of developing instructional leadership teams at each school. We started that learning through the end of last school year on our principal and assistant principal meetings. Dr. Tyson and Ms. Adler are doing a delivery at the principal's meeting, and the 3 of us also have developed what we call 4 instructional leadership teams, where that's at the district level. In between that, between the school level, we have the school level, and then the district instructional leadership team that will look at the district perspective, this dropped off here, this improved here, just like a school-based curriculum PLC needs. It says, what did you do in your classroom? You do that.
Yeah, because I've seen it and it's incredible to see just the,
That process will help us, to bring those best practices and really just maybe move supports as needed based on the data. The data will drive where the supports may need to be adjusted and and then from the moving support standpoint, we're not going to back off on the support at Lulling. We know that this is going to need to be a sustained effort. Meeting with all of the departments to continue that work that we started, but also start new work, the departments that we haven't even touched yet. So I will be there with support. Anything needed from that side, she already has a great plan in place, and we will, through that ILT process, be able to see instructional leadership team. I'm sorry, thank you, Beth. ILT, another acronym, instructional leadership team, the core of the district and the school level. Schools will have their own process of doing that and just seeing how those PLCs are functioning at each school as well. So with that structure and process in place, we'll be able to have a early warning sign or early signal on how we can better support schools.
because even when she was mentioning about the special needs component of it, of what you walk through at Lakewood and how that intervention is needed, you take that knowledge with you, but we know that other admins are having similar struggles, almost like a shared voice of really talking about where are we struggling, not always where are we succeeding, and not waiting until the data shows different numbers. It's what did you do about this? How has this been successful? How can we get the sports?
And I also think, and correct me, at your informal meetings, now share these things as well, am I correct? Okay, on Wednesday, you said you and Dr. Becker would do a presentation. What time?
It's in the
Yeah.
suit.
It's in a suite?
Yeah.
Oh, yes.
I'm gonna have to look at the agenda and I can
Missed
send
it.
you the exact time.
I only noticed it because I'm doing the welcome speech.
It's either
So
1 to
that's
2 or
why.
2 to 3.
I think it's 1 to 2, but I'll give you the exact time if you would like to attend.
No, if it's in a suite, I'm gonna look at it.
No, you would love to attend.
I'm not sure the time was in this group, but we saw it definitely.
I'm just messing with you.
You all are welcome to come from this. Dr. Jackson and Seven, I will be
1 to 2.
modeling.
1 to 2.
Thank you, Dr. Jackson. We'll be modeling, a process for principals, but just know that the process we're modeling is what I think is at the school level, but the three of us, along with the district team that we are creating, for instructional leadership team, will oversee that work and support that work and be able to deploy resources and instructional side and the special education, that in itself, I would have to say, without that position, that things would be a little bit more difficult to manage trying to do instructions. And we could have talked for a really long time about all the things we're excited about, and the special education piece, and COVID has worked. The success team for special education didn't, and it really was just the beginning of a longer plan for how to support special education. And historically, has taken it even further. There's been a redesign of the facilitator support to be more rating focused. So Sherry has planned for meeting regularly with all of those facilitators and her administrator to oversee. So that just to oversee special education, which just speaks to the people that work in that department
I could, John, we'll leave with half of my constituents. I live in the rural district. And more importantly, I think the board knows is Sherry and I invest, we're the second county in national plantation. And I'm with it, not impressed. We're the second county. I know that. And as a board member, I absolutely believe, I believe in giving support. You just need to support people to make sure that, I know the potential. I know the potential. So I appreciate you.
Very
You're here to
excited
support.
about the opportunity.
Any other comments? We have a motion by Mr. Alexander, second by Mr. Gregson, to adjourn. Please second. Thank you, ladies.
Next committee is the personnel policy. Personnel.
So I will go to the staffing update and information provided to personnel needs. So currently you are getting weekly updates, that we are sending you, but this is where we are, this is our final staffing update like this, and we get, that starts in the spring and then goes through July. We will continue to get it weekly. So as of right now, we have this, the caption at the top is actually 40. So we have 40 on that column, and that row at the top, it says resignations, retirement, we have 40 resignations and retirements. We have of the 40, we have 14 said, and total, we have 54, and those are including all the other positions, which are 14 additional
I'm
positions.
sorry, the 25, 26, February to May versus 41.
It should be clear, yes, yes. So we are at a total of 54. As of today, when you look at the bottom, graph, and it says 25, 26, total 54, breaks down high school, middle school, elementary, and we get to the other positions. So it's currently where we are. We do have a few vacancies that we're working to fill right now, which includes a couple of para positions. It includes a state teacher, speech language pathologist. So we just have a few. We're in a good position, and we are confident we'll get those positions. We're excited. Always excited to open up a new school year, but we do feel very prepared.
Yeah, I thought you were sitting staff, and I wasn't looking through the list.
Yeah, it's another attachment.
Y'all have other personnel in our
Yeah, I know, but I can't think of it. Last month, I asked for this,
We're gonna have the resignations, and I think we have a resignation, would you like after this month as well, second file?
well, last month told me that you couldn't put the ID. That's why I put it on the list. It's still separate service.
It
What that
does.
means, so you pay.
So I believe what you were asking for was the specific people that have resigned or in that information, even though it is here in your city separation service, and you know,
It's not just me.
no, sir. So I don't want to give you any additional personnel information, beyond letting you know who separated, but the reason of why they're separating, that information is not provided.
You're saying that you can't give the board members names of the people who resigned?
You have the names of people that have separated service or that have been appointed. I believe, and Mr. Alexander talking in the way I understood your question last month was, can you tell me of the people that we gave you the breakdown that, of the number of people, we didn't give you the names, we just gave you the number that resigned or retired. And I think the follow-up question was, if I can't remember, was, well, who are they that resigned or retired? And that's the information that is protected, to say what type of separations they have. I can't provide that information, but I can tell you of the 40 that resigned or retired, 20 resigned, 20 retired, but we're working. It's personal information.
Yeah, but they are our personnel. This is the board's personnel.
So,
What is the legal implication of not being able to share with the board the names of those individuals who retire? I don't think that is necessary.
so at one point in time, we had provided that information. We were advised probably about 2 years ago to not put that information out as it was protected public information. So in the board meeting minutes, we had it. We were advised not to, but we can certainly have Ms. Gray and Ms. Brown follow up to see who we got that guidance from in reference to the statute that we are trying to protect. I think we're trying to protect personnel information relative to personnel.
I'm not talking about the personnel information. What I understand, you separate this into two categories. The request, what I understood you to say, because I didn't know what was going to happen, but the school board you're saying you can't provide the school board the names of the individuals who resigned. And I just want to know what statute, where is that says that the board does not fit. The board, they work for the board. If they don't work for you, you shouldn't have that information. But the board has a right to that information because those are employees of the board.
I want to provide you what the board is.
What the board asks for. And if the board wants to know who are the individuals, not why they retired, why they resigned, or any litigations or anything, but wants to know who the individuals are. You're saying to me that you can't give us that. And I want to know where is that?
And I think it initially stemmed from medical leaves, I believe at the time, because people were using that. An employee saw that their name was on the medical leave piece and felt as though that was privileged or private information, where we had it categorized in personnel items. So we simply changed it to not termination. Correct. These are the people that are leaving, period, without classifying the exact type of leave, but we'll bring that.
But that's
so
not
everybody's clear.
right. But that's not what I heard just now. What I heard just now is that I can't provide the names of individuals who resigned, and that's not what I heard. So what you're telling me, because when knowing the name, these are employees.
Yes, sir.
So when you look at Part B of classified, separation of service is numbered, and all of them have 4.5 to 5.5, and then you have number 7 is 29 years. That I just read this always and say, okay, that's probably retirement, whereas the other one is probably resign. And I'm curious as to what is the information, like why do you know who's resigned versus who's retired from that pool?
They could retire.
Oh, I know, sure. But I'm just like, what is the goal in having?
The goal is to know. I don't, you know, if you're not gonna tell me who resigned, you don't need to tell me any of this other stuff. But I don't think the board has to justify, to whom do you have to justify your right to information?
No, I'm just asking.
But then that's not a valid question, because the board does not have to justify to anyone what you need the information for. If the board wants the information, and practice has been, if a board member requests information, then the information is sent to every board member. So every board member has it. Now, I don't want to get into the whys and all of that sort of thing, but if the board member wants it, what, maybe the board member just want to look at it to see, well, how many people you have meeting during the course of a year. But that's his own personal business. And does not have to justify that to anyone.
Administration will bring back that specific information. So
Next item on my agenda is phone calls and
Just want to remind everyone that we are limited on our volume capacity. If we could just use our outside voices to help those who are documenting this meeting understand what's being said.
Ms. Christian.
That's you, girl.
You should coach voice.
I'm struggling. Am I here?
Yes.
Teacher voice, diaphragm.
Use your coaching voice.
Push it out.
Thank you for the opportunity to connect to board revisions. This is a recommended action to approve recommended revisions to board policy procedure 606.3, behavioral health services for students for first reading. This goes back to legislation session of 2026, where our school district was actively involved in helping revise the language and revise the language that was presented from legislation approval for behavioral health services for students to receive behavioral health services during the school day. Some of our members went to legislation and worked with them and developed the language on the bill set out to the so this was a hot topic in the legislation. So once this had went through legislation, my understanding is that we did not sign it, that we did not sign it with school legislation. So this goes back to House Bill 250. And this is, as stated, for medical necessity, behavioral health services to be given to school day for students with those needs. So this bill was before me, and as you can see, the two attachments was we already had a test. Devised with procedures for these years, for students to receive behavioral health services.
In our schools, and so what we did was made sure that we were in compliance with the new law for medical necessity and some of our procedures on how to best facilitate that process with the students, the third-party providers, your behavioral health providers, and some of the things we think about in what we've learned in the past year specifically for the bill and to be compliance with the law and those students receiving those medically necessary services. There's two attachments. The first one is the board policy. As you know in Assembly and probably can see, the green will be part of the changes and they're side by side. So we added in portions with the work of Ms. Gray as well as Ms. Mindy Van Hoven and myself to go back through and really make sure that we're not only in compliance but also thinking from the lens of the school district as well. So we added in some language that needed to be there in the policy to define certain things in that process. And then you can also see the second attachment is the procedures. And we added in, and even some of the language changes, I wanted to make sure if we change one word that it is highlighted in green so you're able to see those changes. So any changes we had there were marked on the procedures as well as the second attached item, to make sure that we have an efficient, informative process and procedure that we can communicate to parents and some of our support documents.
Is this was in a 2026 session, right?
Yes, sir.
Okay, it's now Act 944.
Okay.
Governor did not sign it, and it became law without the governor's signature. Act 944.
Will this new legislation have any fiscal impact on the district?
No, sir, not in the operations of changing the revisions of the policy and the procedures as is. It will not impact us fiscally to put in these procedures.
Good question.
Yeah, great question. Thank you for that.
There are no other questions. We'll move on to revisions to policy and procedure 3.02 district debt first reading.
Okay, thank you for your time.
Also note the fiscal note on the bill also says 0. Not that that's always exact.
Right. Can't believe it.
But I'll say this with the fiscal note, if we would not have interceded with modifying the language of this bill and worked as hard as we would have, it would have absolutely increased some of our health insurance costs.
100%.
Because it would have opened the doors up for all these companies to come in. So while it may not right now, that's in part, I think, seeing the impact that some of our employees have had relative to legislation. So.
Mr. Davis?
Good evening, everyone. This is the second part of our first phase of various policies and procedures revisions. You've seen the first reading of the budget side, which is going to second reading this month, but this is the other half, which is the debt side, really going into more details and bringing our policy and procedures up to best practices and other legal ramifications and requirements to make sure that we're in compliance. So the first one that we're going to talk about is 3.2. We did do some modifications in terms of adding some policies, but I'll talk about those in a second, as well as procedures. This 3.2 really kind of covers at a high level what we're required to do in terms of going through the State Bond Commission. The proposed revisions, as you can see in the side-by-side that we're continuing to model through the Assembly guidelines, you can kind of see that we're adding some additional language in terms of how we offer that debt, as well as the procedures in terms of what that debt is eligible to be spent on. It's, again, providing some additional clarity and some additional, best practice language to make sure that we're bringing our policy standard up to expected best practices. So 3.2 really in the policy covers a lot of those various details, as well as emphasizing that 35% threshold. We've always disclosed that item in our ACFR, or our financial reporting. We just kind of codify that into percentages here. The other item I wanted to note was in the existing language, there was bullet 2 that existed that talked about the tax elections and things of that nature. We are going to take that small little sentence or so and break that out into a different, its own separate freestanding policy, and we'll talk about that in a second. So it's not that is being deleted, it's being removed and allocated to a different location. When you get into the details of the procedures, again, a lot of that wasn't as much detail because we were kind of in alignment with our best practices. We just added some additional language about record keeping, making sure that my office, as well as working through our council, make sure that we have all of our language and documentation in place based on legal requirements to do so. So that's why you can see a couple bullets on the procedure side when you put those comparatively against each other. So 3.2 was, again, bringing an expectation up to best practice. None of these would be resulting in anything that we haven't been doing, and I'm going to kind of cover that throughout. This is again codifying language that we've already had in practice and putting it into P&P, if you will.
Any questions?
Mr. Neighbors, the colors on here, I'm sorry. So if I'm looking at the side-by-side of the policy 3.02, the gray, I guess that's gray, I don't know. Is that the new? I'm sorry.
It's okay. Sorry, my internet was spotty.
Okay, okay, I forgot we had the internet issues. We can do this tomorrow.
The green should be the changes. There you go, right there.
Green, maybe
Thanks,
I'm going
Ken.
colorblind. I don't know.
Green, red.
Okay, maybe.
Green and red is being deleted.
Correct.
I see green, red, purple, and
It's coming.
Pink.
dark brown. Well, I don't know.
Salmon.
Hang on.
Procedure and policy.
Policy, that color, the darker color.
Red's delete, green is change, I think, which was
I think they're seeing something slightly different. There we go. Green is additions, red is deletions.
What's the
The
dark
gray
color?
is kind of the bigger paragraph of what the entire thing that's being added. That's,
That's additions?
yeah, the before incurring, that's additions.
Okay, all right, that's what I was, we have 4 different colors on there, unless I'm gonna color
Sorry.
as possible, but it's all getting old, so.
Understood. Correct.
Then it's just the green and the red. Then you do the side by side, I think gray is anytime I shift or move anything.
It may have been relocated from a previous.
Yeah,
sentence.
his is, I don't know.
I saw it too, yeah.
Your computer is,
So
It's
red
fighting.
is deleting, green is,
Adding or moving, yes ma'am.
and gray is,
your computer's been hacked.
I know white looks good.
What's that?
Yes,
All right, that's. I'm
white is
good.
existing.
Mr. Gregson?
Yeah, yeah,
Okay.
I got like 18 different colors on
Yeah, I see that too.
They wanted to put the spectrum on there, so I'm good, we'll figure it
That
out.
wasn't part of my test, I'm
It
sorry.
wasn't missing
Then I
neighbors.
add them, and then I delete them, and then I add them, so
Yeah.
that's probably what it's
I'm-
recording, only because I'm constantly having to change formatting and things like that too.
Yeah,
So like some of them are the darker green as opposed to like, it looks like the red over the green. If I've deleted something and then moved it, I think it's clashing colors. So it's really just red and green. So like this one, it's much prettier.
oh, you can bring us a chart whenever you change colors.
Red, remove, green,
They see red as
add.
Okay,
Yes.
good.
Okay.
And so, again, you can see the policy side and then the procedure side as well, at least for this first bullet.
Yeah.
Other questions on?
Yeah, I was just trying to figure it out.
Anybody else? Questions?
No, sir.
Okay, we're gonna move to item D, revisions to policy 3.02.01, revenue anticipation notes, first reading.
Yes, sir.
That's still you.
Still me. This is going to be a lot of me from here on out, Mr. Alexander.
Rest of the way, right?
Almost. 3.2.1, this is revenue anticipation notes. And again, this is doing some clarification of best practices. We've always had, or we've had for a significant period of time, the ability to offer revenue anticipation notes. And based on some discussions, we actually had done some about 25 years ago when I went to the State Bond Commission last week. So we have done them before, which may have been why this policy was actually put in place. What I'm proposing in this revision, it's just a policy, so there's only just one side-by-side to look at. But what I'm also going to propose is modifying the language to also include other types of short-term debt, because the board has the ability to offer what they refer to as short-term, which is any maturity period less than 10 years. Obviously, the revenue anticipation notes, because of their basically 12 to 15-month time frame, that falls within that short term. This is just opening that door a little bit wider so that in the future, if the board wanted to pursue an option to have the ability to issue a shorter term note compared to our normal 15, 20, or even 30-year notes with regards to like general obligation or sales tax bonds, this really codifies that language in terms of putting it into policy. So we're putting that language into the policy, and also I'm going to propose, once this is passed, a revision of the name to not just be revenue anticipation notes, but short-term debt, so that it encompasses both of those categories.
Well, you wouldn't do that now.
It's going to be part of the second reading process. This is just the first reading process.
Any questions from anyone?
We can do it on this same policy on the second reading, you said?
Yes, sir. This is just the first reading part of the process. It'll go to second reading next month, and we can adopt that change.
Okay, you got E, policy procedure 3.0202, tax and bond elections, and sale.
Yes, sir. So
First reading.
this is again the expansion of that previous issue or that previously revised 3.2. That sentence where I told you about we talked about tax and bond sales elections. This takes that language and really expands upon it in terms of our legal requirements. That's why this is one of our new policies. It really kind of refines and adds in the specific details. The policy is very, again, condensed. It adds the ability, it kind of takes that sentence and says, we have the ability to do X, and here's how we do it. The procedure, when you start looking into it, it gets into the weeds of exactly the public meeting notice, the announcement in the public journal, all of those steps. It really gets into the detail where, while it didn't exist before, these are also things that we've been putting into practice. So this is taking, again, what we've been doing and codifying it in best practice and policy and procedure for the board's adoption. And the procedure gets a little bit more detailed because of the steps you have to take, the authorization, the public hearings, all of those types of natures. All that detail is covered in the procedures guidelines.
So are you saying we had been doing this before,
Yes, sir.
but it wasn't written.
It was in a procedure manual that was, I'm gonna say not behind the scenes, but in operation at the business office. This is taking a lot of those expectations and bringing them up to actual policy and procedure guidance.
No, not this way. It was not policy, it was procedure. It was a procedure that was not a policy. That's the way that business was being done.
Yes, sir.
Now it's being
And it
done
wasn't-
because you're required to do it by policy.
I don't think it was on board procedure, right?
Correct. It was more informal. Okay.
All right. Any questions on item E? If not, we move to item F, policy and procedures 3.02.03, post-issuance tax compliance, first reading.
Yes, sir. This is, again, a similar in terms of practice. With every general obligation bond issuance, there's been a lot of language in some of the documentation that's been provided with regards to legal requirements. So from a policy and procedures perspective, this is taking a lot of that language as vetted by our bond counsel and revised to make sure that we are bringing that up to policy level. So again, this was a procedure, thank you, Mr. Smith, in terms of clarification. This was a procedure that was already in operation, but this is elevating both of those in terms of language and operation into true board level policy and board level procedure in terms of documentation. This one unfortunately gets into a lot of details in terms of some of the compliance and some of the legal requirements that are necessary in terms of various filings with the state or various filings with various regulatory agencies if that is required. So this really puts that into play and puts that into policy and procedure for us.
And you said this was reviewed with board council? or
Yes.
They reviewed it, say?
Yes. Mr. Akers helped me make sure that all of this language kind of matched a lot of the language that's already in our general obligation bond and various offerings that go out.
Thank you.
Any questions? Any other questions? We move to item G, revisions to policy 3.03.01, the board's local property tax, first reading.
All right. This was, again, kind of a continuation of those tax and bond elections. This is more about the actual millage setting and the property tax itself. Again, this is not so much an overhaul of language. This is adding additional language for clarity. There is no procedure for this one, so this one, again, is just one side by side. This gives you, again, some more clarity in terms of the sales tax and the principal and interest that we do in terms of some of those sales tax bonds, adding more detail to what we've been doing. And also in terms of working with the assessor in various capacities as well. The one bullet that was added was the specific language about canvassing. If you remember last month, we went to the board with regards to the result of that millage election. We had to go through the canvassing procedure or the results of it. That language, while we had been operating under the need for it, it was never officially put into our policy. So that third bullet, Roman numeral 3, is really codifying that and putting that into actual policy for the board.
Any questions on G, item G?
So I don't think we've adopted the millages for next,
Not yet. That is coming probably next month.
Okay.
With some additional discussions.
so it has to come next month.
It has to come next month.
This concludes all the items on the personnel and policy committee. Mr.
Make a motion.
Motion by Mrs. Weber to adjourn, second by Mr. Smith to adjourn.
Second by
Ms.
Smith.
Weber, Mrs. Smith.
Thank you, Mr. Davis. Thank you.
Yep. Thank you.
That brings us to the Finance and Audit Committee. Meeting is now called to order. We have 6 items on the agenda. First item is the bid acceptance of janitorial and paper supply. Yes. Okay, Jim, Mr. Rowan.
Yes, sir, thank you. I'll just introduce the item real quick and then turn it over to Mr. Dunmiles, whose team does a great job with this, managing this janitorial and paper supply bid acceptance. We recently came out to you with the authorization for the bid. Mr. Dunmiles' department received those bids. They did a great job with the tally sheet. If you can see, it's pretty painstaking with the amount of different items that are listed on there with approximate quantities and then what our expected or anticipated costs are. So I'll turn it over to him and then, we'll entertain any questions that you may have.
The bid actually it went down from last time. We went on a 2024 to now. It actually went down actually less $1,000 from before. They didn't really change too much. Pretty much, last time we went for bid, only 8 went out. This time 10 came back in. Pretty much the same person, company came out with the most, of course. Economic was the biggest person. They bid pretty much on all the stuff, but unfortunately, some got the majority of some other stuff also. So, but pretty much the same items. Nothing different. Try to change something, but nothing too much extra.
And just to point out before any questions, the amount is an estimate because it's based on, trending as far as what we typically use at that price point for those items. Just to kind of reiterate and mention again, we are taking a more hands-on budgeting approach this year to janitorial and custodial supplies. Mr. Dunmiles has done a good job in establishing budgets for each school based on trend data that we looked at. We're going to monitor that throughout the year and adjust if we see things that are out the norm or out of kind of their size school or category school. Their counterparts, if you will, and just take a lot more proactive approach in that to keep this budget in line throughout the year. So we're here for any questions that you may have.
I have a question. Do you get your supplies in as needed? Buy everything? As needed, yes, right. As needed. And do you find at the end of the year you don't use as much stuff as you? Well, it all depends what the product is. I know it's almost like it's seasonal. Certain things of the year you need certain things. So you watch what you order depending on what's going on. End of the year you got a lot of deep cleaning. It depends on what's going on. It doesn't. We try not to over order because, like I say, as needed basis.
And Mr. Dunmiles has a pretty extensive background in the custodial area, so he can kind of see. You're asking for 15, containers of wax in September, but you're not going to wax until mid-year or the end of the year. So why do you really need that and stockpile it and store it when we can keep the resources here and distribute as needed? So they do scrutinize those orders as they come in to see, is this really appropriate for this time of year? And if not, we question the school and get with them and try to get an understanding of why that request might be made. Because we want to protect the resource, if you will.
And Mr. Alexander, if you even offer, hey, we'll give you lunch, give us some more paper towels, Just teasing.
The reason I asked the question, if you get this stuff all at one time or if you get it when needed, because you could have a storage problem. Right.
Absolutely.
Well, each item is depending on the size of the item. We want to limit them a certain amount of items in their warehouse. Yeah. We got the new side of the warehouse. We still limit it. We only certain items, certain areas can hold a certain amount of things, and not just janitorial. We got books for everything else in that warehouse. So we still got to be cautious what we hold in that warehouse. Yeah. We're a good student of what we got, and we try not. I treat everything in that warehouse as mine. I just don't send out because it's there. I really don't. You might not like it, but I try to be a good student of what I have. I treat it as mine.
It's okay if they don't like it. You're going to take shit, baby. I like it.
I do. I really do.
I know you do.
Yeah.
Family.
That's my family. My crew is my family.
The thing's when you toured it with me a few years ago, things in order.
Yeah, I tried.
You know everything.
Yeah, I've been there long enough. And actually, like Mr. Malone said, I came from a janitorial background, and I know what it takes to wax. I know there's certain strip of weight, break this down, so I know you don't need as much. So I ain't gonna order as much because I try to be a good student over that my budget, so it don't exceed what it go.
Appreciate that, bro.
Let me just ask you this question, along those same lines. Let's say that you wax during a certain time, but during the off-wax season, the price of wax goes down considerably. Do you think that it would be in our best interest maybe to go ahead and take advantage of that drop in price and save the board?
Yeah, well, it all depends because the wax has expiration date too. You have to watch it. A lot of people don't know that. You can watch it. It has because some time the wax will expire.
But George, I would say, and correct me if I'm wrong, it's a bit of a double-edged sword that we're locking in economies of scale, so we're getting a pretty good price point per unit.
Yeah, yes.
And the bid kind of locks in that amount for that period. Sometimes, traditionally products tend to go up in value. so, our cost, I should say.
Right.
So we're locking it in at that lower rate. I guess there is a chance it could go down, but for this term to get that best price that we attain, one, for the economy of scale, but also two, for locking in that period, we're kind of tied to that. Now, if we saw prices across the board went down, you know, at that point in time, we'd have to reconsider maybe going out for a bid again
Right,
within that
right.
period. But the numbers are kind of locked in to those units because that's kind of what they're proposing on to give us that discount, if you will.
Right.
Yeah.
Yeah, once you get that bid price, that bid price, regardless.
Can't return anything.
No, I ain't, no, it's not like that.
Well, I guess my point was not really, the point was just to say that I don't think that we could be so locked into, and I would not like to see us so locked into a process that it prohibits us from being able to take advantage of the opportunity to get a best price
Yes, sir.
Mhm.
on items.
Right.
Yep. And we will actively look at that if we see anything jumping up too high, see what our
Yeah,
options
yeah.
are. Yes, sir.
I was at grocery store the other day, they had 4 of those dozen eggs for $1.
Pretty good price.
I had a hell of a time trying to warehouse it.
Took advantage of it.
Yeah, I took advantage of it.
The warehouse is
Yeah.
Anyway, that's.
Yes, sir.
Yes, sir.
We'll certainly
Yeah,
monitor that.
we'll watch it though. I definitely, I like it still, but you know, I definitely watch it.
Like we have to get anything from the Middle East.
Yeah. All right.
Okay.
Any other questions?
We'll go to, next item.
Appreciate it.
Thank you for being
Thank you, brother, appreciate it, man.
waiting it out in the heat.
Next item is, item B, approval of the independent audit firm's, recommendation. It's the audit firm itself.
Yes, sir. All right. Told you I'd be back at the table and got the rest of the way down, so here we go.
You'll be here for a little while.
A little bit, yes, sir. This item is talking about the financial audit firm. This audit firm is the one that does multiple reports for the school board. There's some attachments that you'll see in the executive content. One of them does have like a summary letter that kind of gets you a kind of a very high-level overview of what engagements that they are required to perform, and then the timelines and the deadlines and things of that nature. So there's 3 actual engagements. One of them is the full fiscal audit, which is as of June 30th, 26 and 27. The other is the Board of Elementary and Secondary Education, what they refer to as agreed upon procedures. There's various data points and things that are issued as a second report. That is also part of, as a separate engagement letter, but that fee is included in the primary fee. And then the last but not least is the state agreed upon procedures audit. That is via the legislative auditor that we've been for the last 6 or 7 years. Those are those additional expanded procedures that they do to make sure that they are having some comfort about various governance policies and the execution of various key critical areas such as credit cards, ethics, etc. So those functions are 3 independent functions, if you will, but it's always best practice, or it tends to work in the eyes of the company being audited to have those covered by the same organization at this time. So just to give you some background, Malden and Jenkins, which is formerly Laporte CPAs, they've been doing our audit for the last 6 years. The proposed engagement letter would take that 2 more years just because of a continuation. They like locking things in for a 2-year term. The cost that you can see for each of the years is disclosed in the meeting agenda item, as well as the proposed cost for that separate, that state agreed upon procedures item as well. And we've historically been tracking online with those estimates.
What was the fee for FY '24 and '25?
Let's see here. I believe it was hovering around, I feel like it was around 68 to 69,000 for each of them. I think we when we put the 2 years together, it was within 1,000, 2,000 of the proposal that you see here in front of you.
And will Mr. Murray still be the partner in charge?
Yes, sir. He is the signing partner on that. And again, I have not heard anything in terms of a change or any sort of delineate or change in staffing. That also kind of helps with some of the continuation. When we have the senior or the manager on the job, it helps with continuity, so that in so many words, the comfort level is the same, because they can be familiar with our process and procedures, and they can help make sure that we are providing all of those documentation that they're looking for without starting from scratch, if you will. And
So the staff, you think will remain the same?
I have heard nothing to the contrary at this point. And this, once this letter is approved, I'd be confirming and sending it back to Mr. Murray to, start the actual process of timeline and getting this rolling.
Did we approve all of these engagements the last year?
Not last year, it was.
Or 2 years ago?
Yes, sir, it was 2 years ago. These similar attachments were provided at that time.
What's their appetite for 1 year?
That could be brought to Mr. Murray because of continuity of staff and that they like to commit in for 2-year engagements. I could bring that question if you'd like and have an answer before the meeting.
I think it's up. I just like to better understand the audit, what's included in the audit, because I've seen other district audits or school district audits that are slightly different in what they provide. And I don't know if it's the agreed upon, I don't know if it's the company, just for us to better understand because the way I understood an audit was the most, what's the software? I forget how you termed it last time. It's the most in-depth or the most.
Yeah, audit, compilation, and reviews. The audit is the most extensive, a level of assurance.
Yeah, so I guess when I think of that, and then I think of what, and again, I probably need a tutorial on this, but how they didn't catch some of those things, and then we just went through the Eisner Amper piece and how that was not, I don't know. I mean, I'll let other board members speak, but I would just say maybe 1 year is my preference, but y'all go ahead, I don't know.
Yeah, I would agree to that. I think it's, I think it would give us time to, again, weigh some of the other options that are out there with regards to what can be done with these. And then at that point, see what we've got looking at 27 and that. And I'd rather be able to do that sooner rather than later.
Sure. Just for full disclosure, we are going to continue to research and look for various options in terms of additional consulting agreements that are of an additional accounting firm, either through Laporte or through folks like Lean Frog, to make sure that we're providing that additional comfort about procedures and various operations of not only the business office but other kind of restructurings as well. So we are not eliminating. This is just the core audit. So we are considering expanding or at least bringing some additional assistance in from an outside, not just the Eisner Amper version, because they were doing like a deep dive of what exactly happened, where we're forward looking. This would be more a procedure and really getting into the details of, as Mr. Gregson noted, what could be done differently so that you guys can really get an understanding from the financial perspective. Because the audit, the assurance level that we're talking about, yes, they do various levels of procedure and documentation, but it's not to the same degree in terms of expectation. I think that's some of the disconnect that was understood or was uncovered as a part of this review in terms of trying to understand exactly what they are responsible for presenting in this engagement versus what was expected of them, at a board level. So I can go back to them as well in terms of the 1 year agreement.
The question of 1 year, 2 years, a good segue.
Right, this is what I'm trying to get it now. And Mr. Gregson, what you are requesting is that this audit be limited to a 1 year contract?
The agreement part, the agreement with the firm for 1 year.
Now, and we need to make a decision on that, because I heard one other board member say, I agree with you. Is that what you want to do? Do you want to change this to a 1 year?
I personally, and again, just me as one person, would like to see, and I know what you're saying, just to get it to 1 year so that, obviously, I at least for me, I can better understand what they're looking for, but go ahead, it's your.
Well, I think Al was getting ready to follow up on it. I wasn't trying to cut you off. I'm just trying to get to where are we going? Yeah. Are we going to ask that the change be made here where this is a 1 year contract rather than a 2 year?
We could do that.
Yeah.
If that's the direction of the board, I can absolutely go back.
If that's where you want to go, then we need to say to the superintendent to make that change and bring that to the board table.
Yeah, and it's up to others to speak. I think
And
Scott.
again, a point I was going to make is I think kind of related to the question of 1 year versus 2 years, also the question of auditor rotation.
Correct.
you know, I don't know that we're at the point where we were with Poster Wade Netterville. Poster Wade Netterville is the predecessor firm to Eisner Amper. And we reached a point where they did an audit for 8 or 10 years, and we thought it was appropriate to rotate auditors. So I raised a question, are we reaching that point with Malton and Jenkins? We're completed year 6, this would be years 7 and 8.
Yes, sir.
You know, so I raised a question along with, to kind of piggyback off of what y'all saying, as far as 1 year versus 2 years.
And to that point exactly, it was my understanding that with regards to completely going back out to bid, we would be limited with time constraints here, which prompted my initial question that was brought up, well, how about instead of 2, we just do 1, and then maybe that's what I think is worth exploring
I've
on our
always
end.
been supportive of auditor rotation. It's just a different set of eyes. I know it is it's kind of a nightmare for the business office, especially under the circumstances. I wouldn't advise us to make that transition now with the business office already gone.
Right. Thank you, Mr. Ross.
And that was sort of my thought, I guess that's the background of my thought.
Right, and I, I'm a firm believer like Al in the rotation, but however, I think that not only the business office going through the change that we're going through, but you also have a board that's going through, half the board is not gonna be here. So, it may be in your best interest to let it lie and then you change it later.
I do feel that, I agree with Mr. Al, Mr. John was saying for sure, because, we are gonna have a half of a new board. You also, but I do believe you need to have eyes, and considering what has happened, I have to say, I am somewhat disappointed, because I felt like, we're paying you good money to do these things, and look, my financial background is about this big, and I'm really trying to learn, and I feel like I've learned a lot.
Yes.
But how do we know there's not someone out there that can do a multitude of things within their company? Like whatever, they can do all these auditing, I don't know all of the ins and outs of everything, but I do think we need to maybe not this moment, because like I said, we got such a turnover coming, that I definitely feel like within 2 years, for sure, we need to think.
So you like 1 year?
I do. Mhm.
Also, I just feel like I have to mention the fact that an auditing firm was not designed to catch what happened here.
No.
Correct.
That was not their responsibility, their purview. Did they catch it? Did they miss it? That wasn't their job. And as an, financial auditor, before I became in this position, I guess that's why I feel so sensitive about making sure that we are saying. Now, to that regard, we should switch up auditors. We should have new eyes. That should always be done. But like even with Eisner Amper coming in and looking, they didn't say, oh man, they should have caught this thing. There wasn't a thing to catch in that regard, that the audit was done poorly. So I know that I'm not here to speak in defense of them, but
what
the
we've
auditing
done,
firm
though,
wasn't the problem.
Boudreaux, to address that concern, you're absolutely correct. An auditing firm could not have caught it, because the timing in which this occurred was, there's a gap between the audit and
Yes, sir.
this occurrence. But what we've done is, we've made some, and we are making some policy changes
yes.
and some contractual changes with the auditing firm, where they will be called upon to give us some additional reviews that would help us to catch something
Yes.
in between
Absolutely.
audits. So we don't get caught, wait till next year when we do the audit. It's too late then.
To piggyback off of what Mr. Smith said, the last audit report we received covered the period through, for FY '25 through June 30th of 2025. And of course, the crisis happened toward the end of the year, first of '26.
Which is in this one.
It will be in this.
It will be.
We're gonna get dinged.
It will.
We're gonna get dinged in this audit a little bit. No, right.
So other direction that the board has given us relative to the internal auditor as well, we've already started meeting with Mr. Seth to develop some internal auditing, more cyclical in nature than what they previously were under the previous internal auditor, as that job description was. So that'll be forthcoming. Obviously, we wanted to get our policies and procedures in place first from that standpoint, but our internal auditor will also be included. So just as next steps, we will prepare the agenda item to represent a one-year contractual agreement with the auditing firm, a follow-up from Mr. Neighbors and the board going into further detail about what an auditing firm actually encompasses and does, potentially at a board retreat, or even perhaps after the new board is selected, so that they get the information fresh, so that when it is time to go back out to solicit for multiple representation, we will.
And I'm assuming the fee's gonna remain the same for the 1 year, right?
That I cannot confirm without talking
You
to
can
them.
check,
They-
you
they-
can get that.
Confirm that.
Yeah.
It never has changed before because the scope of the work
Yeah.
doesn't change.
Yeah.
So they can't give, we've tried that before, Al, and they didn't give us a break on the second year on it.
I will confirm that. And just for clarity, that first letter, the one that says government communication of the attachments, that does give you a fairly high-level overview in terms of what exactly steps and the procedures and things that they do or they're planning to apply, at least for this first year. So that one may be, without getting into a lot of the technical language of the three specific ones, that one can give you a very high level, if you want to skim through that in terms of clarity. That will kind of be an executive level summary, if you will. But I will go back to the board.
Superintendent summarized very succinctly what, captured what the board wanted.
Sure.
I don't think that we need to take a vote on it.
Yes, sir, I
Unless you
understand.
want to.
I understand, it'll be represented in the agenda
Yep.
item.
I will update that for you for you.
Got it.
Yes, sir.
Great.
Appreciate
All
that.
right, then we move to the next item, the approval of the municipal advisor.
Okay. Similarly, with regards to various capacities of various debt offerings, it is in the best interest of the board to engage, or at least have engaged, the services of a municipal advisor. This municipal advisor that we've used for the last several years has been Argent Advisors. I actually have them, Mr. Lucia's here for a separate agenda item coming up in a little bit. But this engagement letter would basically lock in their services as their behind-the-scenes person, similar to the bond counsel in terms of making sure they're working in our best interest. This engagement letter is for a 3-year term, which kind of correlates to our planned recovery period, if you will, with regards to the revenue anticipation notes. They would be one of our steady guiding forces behind the scenes, in addition to our bond counsel, like I noted, to make sure that we're on course with regards to various offerings, placements, however we're going to proceed with those next steps and those bond offerings. They were a very helpful guide in the last few weeks as our current offerings went to scale and to scope, and you'll see those in the next couple of resolutions. But this engagement letter would be, in so many words, taking us from where we're at for the next 3 years to get us through this cycle.
Does that cost total of 3 years or annually?
That is
So
for
this-
these first two offerings. So right now,
That's
that if you get into the
For this
percentage,
year.
yes, sir. If you get into the actual engagement letter, it talks about the basis points.
That's
of
what
how-
I saw.
Correct.
When I read it.
So how much their fee is depends on what we offer. So the hope would be, obviously, we're not going to repeat the sales tax bond next year, but the RAN offering that we're doing, if we decrease that volume and are able to, work our number down as we've planned, the actual fee for that portion would decrease over time,
Thank you.
Okay,
at least prospectively.
all right. Let's move right along to item D. Item D is the discussion of state-funded stipend to district employees, and this is a committee meeting. I asked Mr. Neighbors to put this item on the agenda because I did not think that in our previous meeting that we brought this item to closure.
Sure.
And I felt that we needed to have an opportunity to bring it to closure. What we did during our last meeting was to receive the report of what action the judge took and why he took the action that he took. But we did not talk about what are our options based on that action, or do we want to pursue this any further? If so, what options do we have? Or was that final, what the judge did? So we need to bring this, in my judgment, to closure. And I think I will turn this over to the board for discussion, by simply just pointing out what, you know, where are we in terms of, and maybe we need Darrenisha to come up and give us some, the action that was taken by the judge. Where does that leave us? Is that final, or are there any other options that the board has?
Was it, let me ask you, just so I'm on the same expectations. I asked for similar information, so just so you know, is it single phase or two phase? What I mean by that is one, to the legal aspect of it, and two, what is the appetite of the board as far as the option B and C? Is it, so it's two phase?
Correct.
Okay, thank you.
That's where
I see it.
right. And if we accept this and want to just say, let's, you know, accept this and move on, then we need to bring it to closure.
So before we turn it over to Ms. Gray, if it's okay, Mr. Smith, just in general, just some parameters, right? It's the governor's executive order, they're basically withholding part of our allotment, taking it from our MFP allocation, taking that money basically from it because this is the way the law is written, to withdraw it and they give it back to us for the purpose of paying those particular stipends. In the executive order, it did not designate all employees, only certain employees with certificates, which is the information that both Mr. Smith and Mr. Gregson have asked for, that Mr. Navy has put somewhat in this document, because the original numbers were based on 2025, 2026 numbers from the State Department. So I'd like Ms. Gray to respond to Mr. Smith's question just relative to the final, and wait, one other thing. We have not been given direct action or guidelines relative to paying out when, where, what time, the stipend. So we are still waiting that directive. In the law, it's stated that Bessie and the Department of Education will develop the protocols relative to the stipend. We anticipate it to be very similar to what the ones have previously been provided to us with these certifications. We are hearing that we'll be able to pay it in May. So the board does not necessarily have to make a direct decision. You certainly can. But that is not the purpose of the agenda. The agenda is really to be informative and get some relative direction, as Mr. Smith has said. So, Ms. Gray,
Can I just clarify one thing?
Yes.
So my request really was not on the legal aspect, was really, if we can clarify which, you put this, whoever put this together, Mr. Neighbors, you did, okay, thank you. Was who, like what, not just who as in people, but the code, job descriptions that were getting 2,000, 1,000, and 0. That's all I really, just so we knew. Go ahead, sorry.
So, Ms. Gray, you want to go first?
Yes, so there was a couple groups that joined together to challenge the executive order by the governor. However, they withdrew their lawsuit because the law firm that was handling it was disqualified, and they did not decide to reinitiate the lawsuit after that. Some of them felt that they didn't have standing to win the lawsuit, so they decided not to re-urge it because they did not have school boards or superintendents who signed on to be plaintiffs in the suit.
I guess my question is, so the matter is not really just a moot issue. If this board say, well, we're not happy with that, and we'd like to challenge the governor because we don't believe that the governor has the authority to dictate to school boards across the state how they spend their money, when the law, the MFP, specifically, categorically has already put money into certain accounts and say this is how you spend it. And the governor now, as a single individual, the question is, does he have that authority? to issue an executive order countermanding what policy is and what the law says already in regard to the MFP. And I guess that's where we are. Does this board want to accept that? And if you do, that's fine. Let's do that and move on. But if not, if what happened, in the court did not or does not preclude this board from moving forward with some type of action to call to question the actions of the government.
And I believe there are some nuances to that could be discussed related to this board, but it would be more appropriately discussed in an executive session, because that would be potential legalities that I would not recommend discussing in an open forum.
Then that's fine with me. Remove that, because it doesn't end today.
Yeah.
So we could pick this up again, next week or whenever.
My other question about this was there any discussion about, since this board had given raises, permanent raises, if this still would apply to us based on the level of teacher pay that we are already at?
So when this was taking place relative to the court proceedings, or the last conference was taking place. So during that conference, on the final day, we met with, via phone, last officers and the governor's direct representative relative to public education, and discussed us getting a survey to all superintendents on who has paid increases in salaries over the last 2 years. And what was it? So they collected that information. Of course, this is before they counted, and they had just directed, allegedly, legislators to give them whether or not they were going to support it or not. From that, they have not given us any direction. So they have that information. We have submitted our information via the business office. We have increased salaries by almost to the tune of 19%, on average between 17 and 19% the last 5 years. Whether or not they use that, ultimately it'll be up to their discretion. But as of now, we have not heard that yet. Yes.
And I think that it's important to understand how we got here. We got here because the governor had the idea that he wanted to give a pay raise to school employees. He got rejected with the appropriation of the money. So he had to decide, okay, I still want to move forward with this. Now, where can I take money from, and who are the easiest prey to take it from? Because there are all kinds of money out there. The governor could have said, okay, I'll take it out of my own budget and pay this rate. But it's easier to take it from school boards, because school boards have just traditionally been the easy prey. And I find that at this particular time, I hear this board talking about being good stewards of public trust and that, all that sort of thing. I see this as a part of it, resisting these kinds of tactics from anywhere, inside or outside of the school district. So, with that said, unless there are some other comments, I will yield to the superintendent and say we'll move this to an executive session.
Okay, we'll add it to is the next board meeting appropriate, or board retreat?
Board retreat, because it's not done. And according to Darrenisha, no legal action was taken that preclude our ability to be able to move forward at some other time. So I think that we have that challenge.
Okay.
Thank you.
So
Ms.
we'll
Grant.
move that to an executive session at the next board retreat. The second part of this agenda item, aside from the legal aspect, and obviously that could determine whether or not we move forward with it or not.
Yeah.
But do you want to facilitate any discussion on the information that was provided? This is a committee meeting only, so the discussion is totally up to the board.
Can this be moved to
Yeah.
the board
Well,
retreat just because of where
yes.
we're at with heat and time?
Right.
Sure.
Okay, thank you.
Thanks.
I'm good with that.
Is that okay?
Okay.
Did I just?
Can do. Thanks.
Okay.
No, anybody, I'm not really.
Yeah.
I don't know what you got on board retreat.
That's at least 4 items.
We have air
right now.
conditioning.
I'm trying.
Okay.
At board retreat,
I
so.
have no idea, I'm just,
Let's hope. Let's hope.
Okay.
All right.
All right.
With that, then
E.
we'll move on to item E. Resolution of the issuance of $30 million of sales tax bond.
Thank you guys for waiting.
Absolutely.
And sweating.
It's not too hot yet.
You never took your coat off.
I know, I was very impressed.
No, we can't now.
Right, yeah. We're in to win it now.
Sat for 3 hours and never took your coat off.
All right, Dr. Orling, you want to intro or just let me?
You can.
All right.
Go with.
Board, thanks so much, and thanks so much for your patience again. With me, I have Mr. Hardy Andrews of Foley and Judell, our bond counsel, and Mr. Lucius McGee of Argent Advisors, again, our municipal advisors. I wanted to give you an update with regards to the next two resolutions, is basically moving for final adoption and resolution on the two debt offerings that we had proposed back in the June meeting. So we were able to move forward with the guidance of our bond counsel. We were able to go to the State Bond Commission on Thursday, and we're able to get both of them unanimously approved with just a little bit of question and question and answer, which was relatively painless. But both of them were approved by the State Bond Commission, and we are able to move forward. And Foley and Judell and Argent Advisors were able to facilitate basically a bid process, in so many words, with our private placement, and we're able to secure very favorable terms for both of the offerings. We are going to proceed with, at the sales tax bond level, the 12-year option, and there are details in there with regards to like the specifics of the interest rate and the term and things like that. And the repayment schedules are very favorable based on what we've looked at in terms of like the timeline of that. We talked about historically about the 2-year interest only, for the first 2 years, and then 10 years of principal and interest payments going forward. So from a cash flow perspective, that does lean into our bigger plan from at least this first offering, the sales tax bond. So I wanted to at least make sure that they had the opportunity to, again, present any additional information they felt relevant, or also be able to answer any questions with regards to next steps. They will be, once this action is officially taken on Wednesday, there'll be some signatures and resolutions and things in terms of like crossing the T's, dotting the I's, etc. But if I missed anything, fellas? Other than that, I will turn it back over to the board. This is the discussion of the 30 million sales tax bonds.
Correct. Any comments, questions from board members?
It's a 12-year, what's the earliest we could pay it back without penalty?
August 1st of 2032.
That's the earliest without penalty.
Yes.
We can
Well,
refile
that's
it.
when you could refinance.
Okay.
They're callables.
Refinance, prepay,
Yeah.
refund in terms of, we've done those for various
Okay.
things where you basically take out additional debt to pay off other. And it was basically at the half term, so at 6 years.
Okay.
you can't pay it off earlier than that.
No.
But they can call it due in 6 years?
Yeah, they wouldn't. It's at the option of you all. Yeah.
I learned so much on this board.
All right, if we're good with that, let's move on to F.
All right. F, again,
Resolution of the issuance of $35 million of revenue anticipation notes.
All right. Thanks so much. Very similar. Again, in connection with the State Bond Commission, this was phrased similarly. This was the shorter term of the two. This was the $35 million in short-term borrowings, just as we discussed in terms of the policy. This, again, we were able to receive, based on the hard work of Argent and our bond counsel, very favorable rates on that as well, in terms of the estimated interest payments, in terms of the timelines and things of that nature. So we are able to have one lender for both of them, actually. I forgot to mention that with both. So we will be able to move forward with one lender for both of these offerings in terms of private placements that we've discussed before in the past. So this, again, received favorable marks from the State Bond Commission, and everything was able to move forward.
Is that rare to get, is that rare to get one issuer on both of them?
What we did was we sent this to multiple banks, and
asked them to give us their best deal. And what came back is the winner had the best terms of what we could do. I'd love to comment on that for a second. If you think about it, they're loaning us this money at 3.97%. The current overnight money, like LAMP, is 3.76.
Wow.
So it's really not costing you very much money while you have the money here. And I'll be honest, I couldn't have come up with that. I mean, that's a really good deal.
Yeah.
So I thought it was pretty good. The other one was much higher, like almost 0.5% higher.
Particularly given the financial condition of the district as well. What we mentioned, so. Comments, concerns?
No, I just want to, thank Foley and Dell and Arjun for giving, counsel to Mr. Neighbors. Mr. Neighbors, of course, gets a lot of credit as well, but we appreciate their support. Being at the bond council certainly was appreciated. Just know that state bond commission is set up in part by the governor's office, right? So those members, it was important for us to be able to provide the context of our situation while at the same time be able to answer questions. So I appreciate the support to do so, and we think we have obviously a solid plan moving forward, and appreciate the board's support.
Absolutely.
One quick note, on page 4 of the RAN, it states the parish school board of the parish of St. James.
That will fix it.
Yeah, we're gonna fix that. Okay. Sorry about that. Is that the?
I mean, unless we want to give it to them.
No, we do not.
I mean, it's,
We do not.
we don't want to make them responsible for it, we get the money?
No.
Resolution.
Where do you see that?
Yeah.
Page 4.
Page 4, I'm sorry, page 5. Page 5.
Yeah, right below the same.
Yep.
Fixable.
I apologize for that.
I'll have some updated amendment and attachments for you.
Happy birthday as well.
Happy birthday.
Happy birthday, man.
No,
sir.
no, we're not
taking
loaning him that
it.
money. Absolutely not. All right.
All right.
Other questions?
I have a question.
Mr. Ellis.
Has our bond rating been affected?
This is a private placement, so there's no public official statement. There's no rating on this, so it's a lot cheaper to issue this instead of the way that a public bond issue would go. So no, this does not change the rating or anything like that.
Or they're not even interested? Is that what you're saying?
No.
No, they weren't interested in getting it rated, no.
But
We didn't need to go.
We didn't go that route, private
yeah,
placement, not public.
but my question, I understand that. But my question is, have you heard any word of our bond rating affected in the last 10
Not as of yet.
Okay, any further comments, President? I just want to point out that this is my last term and the rest of the half the board last term. When I came on this board 44 years ago, Foley Udell was handling our account, and you are coming on now replacing Mr. Martin, who handled our account all those years. And I do understand that he passed away not long ago, but if that's any indication of the kind of work that you guys do, you're gonna be here when the rest of the board is.
I appreciate that.
Well, those terms. Max is 12.
That's
He
funny.
does have on his seersucker pants in honor of Mr. Martin.
You remember those scissors?
Yes, sir, I do.
That's funny.
He used to have an old saying that I used to tease him about. I said, "Seals make them and suckers buy them."
Never heard that. All right.
If there are no further questions, Mr. Superintendent, we stand adjourned.
We got one more. We got one more.
Accounts payable.
One more? No, not with you guys.
Oh, good.
Y'all are good.
Thank y'all.
Thank y'all so much.
Let's pay our bills, come on.
All right, not yet. Oh, thank you, gentlemen.
Thank y'all.
Thank you.
Thank you.
Okay, accounts payable, I'm still gonna wait for Mr. Suffer to say, let's pay our bills.
Let's pay our bills.
All right.
I gotta ask Mr. Davis,
Yes, sir.
can we pay our bills?
With those two previous
We just
resolutions?
gave,
We just gave the
we just gave
authority.
him some money.
No, we don't have that in our hands yet.
It'll be here in
I make a
It's
motion
good.
to
a
adjourn.
very short period of time. yes, sir.
I'm sorry, before we adjourn,
August 12th.
I'd like to just spend a little bit more time on this.
Absolutely.
Nothing, I haven't seen anything wrong with it.
No.
But I just think it's important that you put it here.
Sure.
Where are we?
Okay.
Give me a high level where we're
All right.
at.
About the budget to action?
Yes, sir.
Yep.
Okay.
I've made some small tweaks to that, and I'm going to continue. This is kind of the last version of this June 26th. The second attachment is going to be the last version, or the way that you see this historical presentation for you. The information that you see is preliminary. We still have some year-end accruals to happen, especially when it comes to revenue. There's some sales tax revenues that we push back into June. Some of the year-end accruals from the expense side have been posted, that we do a lot of salary posting, as of June, for those July and August payments for various teachers. So you can see some of those posted as we, again, work through those year-end closeout numbers. So you can kind of see, when you start looking at the budget to actual, that we're going to land very close with some of our expenditure levels. Obviously, we had some tweaks in some of the revenues and various ups and downs, and some we were ahead in some items, and unfortunately behind with some of the ad valorums, but not as significantly as the original interim budget was prepared, if you remember what that looked like. So there are some movements with regards to where we're going to land. That's why I wanted to put that disclaimer at the top in terms of there are year-end adjustments, there are year-end accruals that are still coming. So this is kind of the best picture that we have right now before we fully close out the books, Mr. Cody. So I wanted to at least give you an overview of exactly where we're at, and also kind of added some additional layers in terms of it had revenues and had expenses, but didn't really give you like a surplus position. So I kind of put that in by the various funds as well, just so you could start seeing it. So I will be starting to, again, review this to start modifying this to be more intuitive and more informational for the board going forward. And you kind of see where we're landing right now. It's not the prettiest picture, and I'm sorry for having, again, my first 4 months has been the bearer of bad news, and month after month, so to speak. But this is at least a decent picture of where we expect to land, with some variations because of, like I said, some of the accruals that are coming.
And what I'm hearing is we won't be doing any of these final year adjustments anymore, correct?
No, that is, some of those are standard audit adjustments.
Okay.
in terms of preparation of financials. We're allowed to accrue certain revenues back into June, like sales tax,
Okay.
and various not MFP grants, things that we know that are coming. We basically are able to post them as receivables, meaning
Okay.
those are numbers that we know that are coming because they've been approved and submitted to the various entities. Anything that is known, we do not go back and do unknowns, much like we've been talking about, conservative and things of that nature. So things that we are known that relate to June 30th and prior revenues and June 30th and prior expenditures, we are pushing those into the right fiscal year so that they hit the right budgets at the right time. And those auditors that we were talking about, they're going to be the ones confirming that those are all the right treatment, if you will.
So second revised had us, I just want to make sure I'm reading this right.
Yes, sir.
Had us at a $20.3 million deficit. We're showing year to date, we're at 23.3 deficit, right?
That, again, that's because of some of the additional accruals and some of the revenue. So I think
And
I said
then,
we're
and then
gonna
what
be
we'll
landing close.
approve on Wednesday will essentially cover this.
That's for next year.
That's for next year, okay.
Yes, sir.
Okay.
Yeah, that.
So this eats into our cash balance, for lack of a better term.
That's one
Okay,
way to put it.
okay.
Yes, sir. At the June 30th time, there will be some information presented very soon about our cash balance and position. I was trying to get to it for this meeting, but again, various moving parts and things.
Yeah. Okay.
So we'll get the final unaudited, if I'm using the right terms here, right?
Sure.
I'm getting there. Unaudited June 30th or 2026 final numbers after all the adjustments, maybe next month, or
I can
or
put that on
send
my
it to
list.
us in some point.
Yeah.
It's some communication, whatever you.
Sure. As we hone in or get closer to the
I know it's
closing
got to
out
be
the
on the
finals.
board, but just whatever.
Yeah, we can make sure that we update you guys in terms of.
I know it's not
where
tomorrow.
we're
I'm just
landing.
saying whenever.
Oh,
I know it takes a while.
We're not there yet.
Yeah, whenever.
Mr. Director. But yes,
appreciate
sir,
the patience. I just wanted to make sure.
Absolutely. And if there's any additional feedback, feel free, we can have various discussions about what you'd, again, like to see. There will be some cash flow information coming, going
So you have a
forward.
different format, is what you're saying?
I'm going to be tweaking this format to make it much more user-friendly for you
I
guys.
appreciate that.
Okay,
Okay, thank you.
all right,
Need a motion?
yeah.
Motion to adjourn?
Motion by Mr. Suffern, second by Ms. Weber. To adjourn, we stand adjourned.
All right, with regards to consent agenda items, based on everything that's here, I think in the importance of it, I'm recommending we don't consent anything. First off, I don't believe we can consent readings. We can actually, we can consent to second readings. I say that we leave those on there as well, just because of what they're essentially encompassing.
I agree.
Okay, so there will not be any consent agenda.
Yeah, and we're not gonna have any recognition
Exactly.
or anything.
It'd be the only
No
one.
recognition.
It'd be the only one, so we just.
Give me that one, Scott. Give me that one.
Just have that. Okay, so everybody's good with that, there will not be any consent agenda.
Yes, sir.
Okay, and we'll have AC for Wednesday, right, Johnny? And as you saw in my text, we're just monitoring, I'm sorry, monitoring the weather, those kind of things. Tomorrow morning, if there are any decisions that we made, tomorrow morning, we put out a message. We'll provide another update tomorrow.
That wasn't bad at all, man.